I'm trying to talk to my rich friends.
Good afternoon. Let's go ahead and call the meeting to order. Ms. Vo, will you please call?
Robert Byrd,
Here.
Barbara Ferrer, Astrid Hager,
Here.
Abigail Marquez, Summer McBride, Marcela Ramirez,
Here.
Kara Sagala,
Here.
Julie Taryn,
Here.
Deanne Tilton Durfee, Jacqueline McCroskey.
Here.
I see her, and Brandon Nichols, and Alejandra Albron Moses.
Here.
Quorum is present.
Thank you. On to our next item. Ms. Vo, are there any commissioners who will be joining the meeting today under AB 2449?
Committee Chair Byrd, there is one commissioner joining under AB 2449 today, and that is Commissioner Jacqueline McCroskey due to being sick.
Commissioner McCroskey, how are you?
I'm
Can
grateful
you
for
confirm
this
that there are no
opportunity.
individuals with you under the age of 18?
No,
Can you also confirm that you have not joined the board meetings under AB 2449 more than twice in this calendar year?
I have not.
Thank you very much. Speeding through this agenda. On to our next item is the transcript from the September Special Board and Program and Planning Committee meeting. Are there any edits, deletions, or changes? Any comments from commissioners? Ms. Vo, are there any public comments on this item?
Confirming there are no public comments on this item.
Fantastic. Let's keep this pace. So moving on to item 4. Item 4 is an update on the first 5 LA's investment on African American infant and maternal mortality initiative, as well as an amendment on a strategic partnership with California Community Foundation, Community Initiatives Fund, who is the fiscal sponsor for the Los Angeles Partner for Early Childhood Investment. With that, I will hand this over to Tara.
Thank you. Yes, I know it's a lengthy title, so appreciate getting through that. Well, good afternoon, First LA staff, members of the public, commissioners. I am thrilled here today to be in partnership with Melissa Franklin, who is the Director of Maternal Child Adolescent Health, and Adjoa Jones, Director of the AIM Prevention Initiative, both with LA County Department of Public Health. And may I add, I was thinking about this on my drive-in this morning. I have the honor of sitting on this panel today with the 2 architects of the AIM initiative. I know you guys are far too humble, and you probably don't think of yourselves in that way, but you truly are. You were the visionaries, and a lot of what we're going to share today are the results of the thinking and the super stellar thoughts and ideas and planning and geniusness of the women sitting next to me. So thrilled to be here with you today. We're going to spotlight all of the incredible work of AIM, and then also get to a specific strategic partnership within it. So getting started. Oh, hold on. We are going to move into our next slide. We do have objectives. So we're going to showcase all of our progress and learning. We're going to highlight milestones that have occurred through the AIM Community Action Teams, or the CATS, the Village Fund, which is a public-private pooled funding effort. And then we're going to provide some context on our proposed strategic partnership amendment, which we actually need as the info item today, which would add an additional year and funding, additional year of time and funding for the CATS Backbone and the Village Fund. And then finally, we're going to discuss future opportunities and First 5 LA's role in support of AIM, recognizing that it's a critical time in AIM's evolution and growth, as well as a pivotal time for First 5 LA as we move through strategic planning, implementation planning. Okay. Maybe, I don't know if the clicker is connecting with the, maybe. We'll get there. Thank you, Amado. Okay, so we are on that slide of our beautiful village photo. Yes, so launched in 2018, an impressive multi-sector partnership with several county departments and community orgs, healthcare provider, funders, community members. AIM is united in one purpose, to address the unacceptably high rates of Black infant and maternal deaths and ensure healthy and joyous births for Black families in LA County. And at the core of the AIM Prevention Initiative since its beginning are 5 core values. You can see them here, based on the lived experience of those who helped shape the initiative. First, racism is the root cause of birth disparities impacting both maternal and infant health through the accumulation of toxic stress in a birthing woman's body as a result of chronic exposure to multi-generational, interpersonal, and systemic racism. Second, Black women up front and leading. Recognizing the importance of having Black women lead at all levels of the initiative, amplifying their expertise and lived experience, Black women know best how the barriers inherent in the healthcare system and other systems are failing them, and know the existing community and family protective factors as well as the culturally relevant care needed to best remedy those behaviors. Next, fostering equity while fighting inequity. Birth inequities impact Black women regardless of income and educational level. Therefore, the work embraces all socioeconomic backgrounds. It is anchored in reproductive justice. Given its strong connection to birth justice, it's focused on anti-racism and anti-implicit bias across all AIM strands of work. And then finally, pieces of the puzzle. We all have a role in addressing and bringing forth culturally affirming programs and supports designed to prevent and counteract this crisis. And then no blame game. Birth disparities are not the result of an individual woman's choice. They are the result of systemic issues. So to start with the data and to understand the extent of the Black maternal health crisis, in LA County, Black women experience maternal death at 4 times the rate of any other group, and infant mortality at 2 to 3 times the rate of other groups, with the greatest disparities existing between Black and white infants and moms. The premature birth disparity is similar. And while overall infant mortality has decreased in LA since the early 2000s, the disparities persist for Black families. These are real human beings dying and leaving families and loved ones behind, due in large part to systemic racism and the failures of systems to adequately serve Black families. The graphic in the center provides that deeper dive into the core AIM value we talked about on the previous slide of racism as the root cause, highlighting some of the manifestations of racism that contribute to disparities in birth outcomes, as well as disparities in many other areas, with implicit and overt bias, racist structures and system failures contributing to weathering on Black bodies through continued exposure to the stress of racism over time. And thanks to the extensive work of AIM and its partners, there is increasing awareness of these disparities and growing capacity to respond in ways that were not previously possible, many of which we're going to talk about today. So just to provide some context of First 5 LA's direct contribution and investment in AIM, we included this table. First 5 LA directly funded AIM has directly funded AIM since 2020. And you can see just kind of how our funding aligns or is a part of much larger funding contributing to AIM. So over the last several years, we have contributed that $3.5 million. You can see totaled at the bottom, but this is out of a cumulative total funding since 2018 at that $26.5 million. Kind of the point here is while we have supported many activities of AIM and remain a core partner in AIM, we are not the sole funder. A much larger community of funders now supports the initiative and with ongoing efforts to continue growing the funder network, which we'll talk about later. I'm proud to say that we have remained one of the central funders of AIM's core infrastructure, which of course is necessary to move the work forward. I'm now going to hand it to Dr. Melissa Franklin to highlight the AIM milestones and achievements.
Thank you so much, and I feel like I must say thank you, First 5 LA commissioners and First 5 LA for your partnership, your investment, an AIM which began with just some information that all felt was unjust, a Pritzker Fellowship and whole person care funding, and a desire to see change for the next generation on behalf of Black birthing folks who experience this day in, day out. Thank you for your partnership in this work. The LA County Department of Public Health and First 5 LA have together been steadfast system anchors in this work. When we began as partners, it really gave permission to the rest of our systems to focus in and address the disparate death and dying of Black folks in our county and in our nation, actually. Many have said, so goes LA County, so goes California and the nation, and it has been a game changer. I also feel like I also need to say that healthy and joyous births are possible for Black folks. This is not a problem without a solution. It is but a problem where system change is required, and oftentimes system change is within the decisions of individual human beings, but policy as well, and we'll get into that as a moment. As you know, AIM is working to transform outcomes by transforming systems so that those systems do a much better job of ensuring healthy and joyous births for Black birthing families. I like to call myself a system healer, and just as a doctor would look for certain clues or observations within a patient's body, to look for evidence of illness or evidence of healing. In system healing work, we look for joyous and health promulgating evidence or artifacts. Policy and advocacy are two of those. Next slide. So some of the system change milestones in the area of policy and advocacy include AIM has launched efforts to create a Black Mother Board, a group of Black pregnant and newly parenting Black women who will advise AIM and the county on policies to improve birth outcomes and the health of Black families. DPH will also launch a Medi-Cal Doula Hub later this calendar year, which is intended to support a successful implementation of the Medi-Cal Doula benefit in LA County. And though the hub is not specific to AIM, AIM's efforts to implement our own doula program and its engagement of the birth worker community in partnership with First 5 LA were contributing factors in designing the actual statewide policy and ensuring its implementation honors those most impacted by birth disparity as well as the birth worker. We've also launched a guaranteed basic income pilot, next slide, in collaboration with 3 other counties, funded in part by funds made possible through the passage of SB 65, another landmark policy called the California Momnibus, that was again informed, written, and advocated for by the AIM network and several of its organizations. The GI pilot sits in MCH, and we have the honor of having that within our programming, and is guided by a committee consisting of AIM members, Black birthing community members, and county representatives. And you'll see, oh, I'm sorry, that is on that slide. Yep, thank you. Sorry, I skipped ahead, I was just so excited. In addition, AIM is published. We were recently published in the Playbook 3, Working Together to Improve Maternal Health. We have a chapter within that book and are honored to present our collective collaboration, which is highlighted in the series. And then finally, the Black Maternal Health Week really began, 3rd year in a row. AIM advocated for LA County Board of Supervisors to recognize April 11th through 17th as Black Maternal Health Week. Thanks to AIM, LA County became the first county in the state to officially recognize this week, which is now celebrated nationally and proclaimed by the White House annually. It focuses on uplifting Black moms, birthing folks, their partners, communities, and orgs that serve them. Each year, we have over 20 events throughout our various community action team communities, as well as collective partners. And then finally, Robert Wood Johnson Foundation awarded AIM the prestigious Robert Wood Johnson Culture of Health Award for $250,000. Yay! Though this award amount was given to DPH as a lead entity, we agreed with our First 5 LA colleagues to serve the AIM Steering Committee to direct us on how it should be invested on behalf of AIM. The group agreed to create a compassion response fund to provide direct financial assistance and service referrals to families experiencing a loss, whether that be a maternal loss, an infant loss, or a pregnancy loss. We are currently in the planning phases alongside AIM and First 5 LA partners to design and implement it. Next slide. Strategic planning. We have made significant progress in our year one implementation as we review the recommendations from our AIM Steering Committee and Community Action Team. AIM is heading into a new season in our work. Though we've always been community grounded, community led, Black birthing person at the center, we really saw the need to create greater equity and power sharing within our movement itself. AIM and First 5 LA, DPH and First 5 LA have been partners working alongside communities, and we really felt that it was important to have a community-based organization as a collaborative partner as we move forward in a new season in AIM. So on the right-hand side, we call it we used to call it the AIM flower, now it's a garden. You see the various collective groups. In the center is the AIM Steering Committee that really is not the steering committee as a center in terms of a vertical hierarchy. It really is about a place of solidarity, of a collective will, of systems being stretched by community leaders and advocates, and us advancing collectively the work of AIM. You see each of the community action teams, which you will hear more of from ADWA a little later on, who also guide our collective work and are the embodiment of the heart and soul of AIM and its work in community. We are continuing structural planning where the First 5 LA partners have begun developing a solicitation for a lead community-based organization entity to be the third leg of what we call a three-legged stool upholding the AIM work. And more to come on that when we announce who that entity is. And that is, in a lot of ways, shifting the power back to the community, which actually prompted the work of AIM. Though community-grounded work is definitely at the center, led out by ADWA and team, having a partner that's a community-based organization and allows us to be more nimble and, again, be stretched a little more as systems. First 5 LA has served on the AIM management team in the past, and so our community partner will be among the management team as well. And since AIM's launch, we're beginning to see early impacts on both families and systems. We often say that stress kills, right? That the stress of racism and multi-generational harm has been a root cause of why we see the disparities persist in infant and maternal mortality. Feedback that we've received through our various doula programs, expecting fatherhood groups, and other efforts in AIM really can be codified as stress reduction, increased self-advocacy and empowerment from doula clients, referrals to other services and providers, preparedness for labor and delivery, breastfeeding, pumping, increasing through doula support, but also through our breastfeeding, chest feeding awareness campaign, which was developed by our community action teams, namely South LA, South Bay Community Action Team, and delivered in collaboration with First 5 LA, and social media engagement, which is very strong. You know, when we first started this work, there really wasn't a landing place collectively for birth equity work or the work of AIM, so we launched blackinfantsandfamilies.org as a collective website, co-designed that with community, designed our social media messaging and channels, as well as really prominent social media and paid advertising campaigns, resulting in over 100 million impressions over the course of the past few years. Next slide.
That's nice. Good.
Thank you. In addition to impacts on families, AIM has also made progress in changing some of the systems that most impact Black women's birth experiences. From our hospital engagement work through Cherished Futures, and thank you again, First 5 LA, for your collaboration in that work, which brought together hospital systems with community leaders to advance change within those systems on how to better support Black birthing folks and address birth disparity within their systems. And based on our learnings of these community advisors, that hospitals have implemented various changes to their clinical practices, as well as strengthened relationships with community and traditional birth workers such as doulas, midwives, and certified lactation educators. And it would be important for me to call out our doula work as well, which launched, that's okay. Okay. Which launched 3 years ago with whole person care funding, and now with California Home Visitation Program innovation fundings. To date, we've served almost 1,000 clients, Black birthing clients, through our doula program, and supported the advancement of Medi-Cal doula, covered doula benefit, which soon. This slide is really about contextualizing the AIM work. Often folks say, well, what progress have you made? What outcomes have you seen? Has the data changed over the past 4 years of the AIM initiative? And I offer something up that we often share with folks. My husband and mother-in-law are caregivers for my husband's great uncle. He is the son of someone who was enslaved. My mother lived her entire childhood in segregation. In LA County, Black individuals are least housed, greatest rent burdened, most CPS involved, Child Protective Services involved, have the greatest rates of reporting of unfounded CPS cases, and are most impacted by pay inequity. I haven't even gotten to slavery and Jim Crow at this point. So when we say over 400 years of slavery and oppression, I become concerned and think that some may think that we're saying 400 years ago, right? What we're saying is we're dealing with the cumulative impact of over 400 years of oppression and of marginalization and of the harms of slavery and families being ripped from each other. We acknowledge that stress kills. Well, stress with unresolved system challenges, mental health care crisis, and continued mistreatment is what we're talking about. So can you imagine that amplified? So this percent of preterm birth over the past several years, you notice that, yes, thanks to medical advancements and other endeavors, that the rate of preterm births, which are our indicator of are we going in the right direction in terms of impacting infant mortality, have decreased over the past several years. However, the disparity still remains. So the top, I call it red-orange. You know, when you had the multiple colors, the 64 count crayons, the red-orange line at the top represents African American babies. And preterm birth is the top precursor to infant mortality, the top cause of infant mortality. You all have heard me share before that both my children were born at 27 weeks, 5 days to the day. And so our efforts to address infant mortality are often our efforts to address preterm birth. And so yes, though it has decreased overall, and the same can be said for maternal mortality, the disparity still remains a stark reality. Next slide. Also contextualizing it is looking at other efforts across the country. Often we uplift Be More for Baltimore Babies, which is Baltimore's Birth Justice Initiative, which launched in 2009. And has now been operating 15 years and are now just now seeing impacts on racial disparities in infant mortality, as well as maternal infant mortality rates overall. Be More for Baltimore Babies is an innovative initiative to reduce infant mortality in Baltimore City through programs emphasizing policy change, service improvements, community mobilization, and behavior change of systems. Sound familiar? It kind of sounds like AIM as well, right? A 2023 report found that as a result of this program, infant mortality rate in Baltimore City declined from 13.5 deaths per 1,000 live births to 8.8 in 2019. And that this decrease was driven by a 7.1 point decrease in Black infant mortality rate during that time span. I've had the opportunity to have conversations with Be More for Baltimore Baby folks, and they are now seeing complete reduction in the infant mortality disparity in certain neighborhoods. Noted they launched in 2009. And we're sharing that to say that this takes sustained support and investment and focus over time, and that's, we call it in it to win it. Right, in LA, sustained focus and commitment until we start seeing a change. We're already seeing ripples of encouragement, right? Doula benefit, doula services being uplifted and upheld, and we're seeing promising outcomes in our doula clients. The fact that there is a sustained focus, that there's investment where there wasn't before, that there is a national conversation on doing right by Black birthing folks, and that in itself something to be celebrated. And with that, I'll turn it over to my colleague, Tara.
All right, well, thank you, Dr. Franklin. So for this next section, we're going to focus on First 5 LA's collaboration with the LA Partnership for Early Childhood, or LA Partnership. I'm going to shorten it to that for the rest of it. And we are looking to seek to amend that today, the AIM effort and the AIM efforts it supports, which are noted here, the AIM Village Fund and the Community Action Teams, or CATS. So our partnership began back in 2020. It's a 3-year strategic partnership commitment with the California Community Foundation. They serve as the fiscal sponsor for LA Partnership. And through this effort, First 5 LA has contributed to a pooled fund with many other public and private funders to support 2 areas, the AIM Community Action Teams, or CATS, and the Village Fund. The CATS are regional collaboratives co-led by community and Department of Public Health. They engage community on countywide AIM goals, as well as developing their own regional strategies. There currently are 4 CATS: Antelope Valley, South LA South Bay, San Fernando Santa Clarita Valley, and San Gabriel Valley. The Village Fund, which seeks to invest in community-driven, innovative strategies to support Black African-American birthing families, and you can see offers small grants ranging from $5,500 to $33,000. And as a part of its work, LA Partnership also supports grantees through capacity building and organizational development opportunities. So how do these 2 efforts kind of fit into the larger AIM initiative? They focus on impact at the community level by strengthening more localized networks of supports for Black birthing families and by building community and collective action among neighbors and residents, similar to our Best Start work. I'm going to now hand it over to Adjoa Jones, Director of the AIM Prevention Initiative and founder of the First Community Action Team in South LA South Bay, to share more about the AIM Community Action Teams.
Thank you, Tara. Thank you, Dr. Franklin, and thank you to all of you, First LA Board, and all that are participating and listening. I feel rather calm today, but I'm so reflective. I'm just coming back from vacation just a couple of days ago. And got the chance to visit St. Martin. And as I was sitting here, I was really reflecting, because as I went through from the French side to the Dutch side, I learned some things that they never let folks forget. There's a few statues that are on display, so as you go throughout the city, you see them. So one was me seeing the first Lady Liberty statue, the original one that the French gave. That is very representative of a Black woman. And then there's the other is a statue of Kunta Kinte, which was Alex Haley from Root, who was a Gambian slave that was brought to America, and they have the chains broken free. And we really, my family and friends, lauded at that, because my cousin that was with the 12 of us was that baby that was held up by Alex Haley in the movie, Kunta Kinte in the movie Roots. And Shawnee is full grown and has worked down in the mission here and serving our communities. But I'm reflective because it reminds me of my colleagues here who helped to architect this work, and working with Tara and First 5, and many here, Dr. Ferrer, Dr. Allen, who was with us, and Helen O'Connor. And I cannot do this and not say all of the community members and organizations that have really partnered with us to do this work. When I was at Whole Person Care, the vision of an AIM Community Action Team, which was just to bring government and community together in a 50-50 partnership to address the issue of AIM, and coming from a former teen mom whose parents were both dual degreed, but had made some of my own personal choices, but was still able to graduate college and go into this work in the first Black Infant Health Program, and see that in our county we had not successfully reduced the incidence of infant mortality for Black babies even to a halfway point. So I saw the need for us to do something differently by bringing those with the most lived experience into the conversation, making space for them to ensure that they too had a voice, and that they had an opportunity to elevate their concerns around equity, especially in reproductive justice, and doing this without any funds. Like, this is just, we're going to get this done, and how can we make it happen? And to see where we've come to having over 26 million be supported in the funding of work, as Dr. Franklin shared, of something that has impacted us for 400 years, just reminds me that we still have to keep going, right? That as I kept passing through those parts of St. Martin, I was reminding that freedom is not just a moment in time. It takes a lot of time for us to come to resolution and bring about effective solutions. So that vision of Just to Aim Cat was a little seed planted. And now we talked about, you saw the flower, which is now a garden, which I say is a nursery, soon to be a forest, right? Because we're going to do all that we can. So what we've been doing right now is, this past year was a big transition year for us. The AIM Community Action Teams worked with the steering committee, the countywide steering committee, to focus on the strategic plan, giving input. And that strategic plan was completed by Coachman Moore and Associates in this past June. And so it was important that folks from the community action teams gave input and were able to help bring about what we thought would be some focus on where we should, as a county, focus our efforts. But also, to now the CATs are looking at developing their own local strategic planning and really firming up that foundation. So we thank you for even the support with the backbone support agencies that are local agencies and Black-led or Black-serving organizations that have really partnered with us to really help build up the infrastructure and capacity of the community action teams to really be able to host our monthly meetings and our planning meetings and the events and work with families like you see in the picture of Freddie Cromer and his family, the husband of Bridget Cromer, who's raising those 5 children, but to bring the community together in an effort to do that. So what the CATs have been doing is really working to continue the navigation and community hubs that we have grown to really lead, helping to build community around birth justice and connect Black families with trusted resources. Just a few ways in which we're doing that. We've been able to develop resource directories, online resource directories, with like Black Women for Wellness, as well expand that resource directory to include our Abundant Birth Project, so that those that may not qualify for the GBI program then have a plethora of resources and services that they can access to. We also look at ways that we can partner with other organizations to support their events, their engagements, and also ensure that clients have access to their services and are well aware of the provision of services they offer. Further, we're continuing to build the organizational infrastructure that allows us to really work with those that are having the lived experience, those that have had stillbirths, those that have had miscarriages, those that are looking for providers, working with, for example, a 19-year-old this is her second child, but she was determined to find out more about why am I showing up at 12 to 13 weeks pregnant and still spotting and bleeding, and they're not giving me any reason as to why this is happening, and I keep coming back and I keep getting sent home. And to really work with her to provide her with doula services and more education to understand what happens prior to 15 weeks gestation. It's not much that can be done, but we encourage bed rest. We encourage talking with you and supporting you through as you navigate this system and these processes. And so doing that continual work and the capacity building trainings that we were able to offer, for example, fast pitch trainings to raise funds for CBOs so that they have the opportunity to learn how to further engage with funders. Facilitation skill training through Collective Impact that also focus on collaborative engagement, planning and facilitation for backbone support agencies, as well as the planning team members. Further, our Black maternal health, mental health, emotional well-being trainings that were provided not just locally but nationwide, because we offer them virtually. They were for the paraprofessionals as well as family members and individuals like grandparents who wanted to discuss the loss of their grandchild but didn't have anyone they could connect with over. So, and then also navigating so that we also know how we support folks by not just saying, oh, well, you'll have an opportunity to have another child. These things happen, it's within God's will. Learning what is helpful and beneficial to share. Next slide. So when we established the first community Action Team, which has been kind of our flagship. We have, like Dr. Franklin shared, we've done a lot of continual work throughout the two spas. We have our fatherhood engagement, our Black Daddy Dialogue, which meets every month. We have referrals to doula support services, and the campaign, which was to promote breast and chest feeding. With that campaign, we were able to create window decals as well as table tents that our partners and many of our members went to local businesses to ask them to put up and make sure that they were in agreement that this was a safe space for breast and chest feeding to promote that. So we've been successful, and we thank Breastfeed LA for also partnering with us to do that. Also, we've worked with AIM and First 5 LA communications team to amplify the work through community events and storytelling, as well as our virtual events that we host once a month. We've done Know Your Birthing Rights workshops, working with other orgs like Black Women for Wellness to focus on the implementation of SB 464, which is to ensure that we have racism and implicit bias training in our clinics and hospitals, and that we are in alignment with our Attorney General with making sure that happens, as well as with DPH, to ensure that we support those clinics and hospitals in doing so. Finally, frontline doulas as an example to provide trainings. We work with them. They're providing trainings to all doulas, no matter what race or color, that are serving women throughout LA County and California so that they know how to become Medi-Cal providers. They're supported in that. It'll be announced who is the doula hub. And so that will even bring more support to all families, not just Black pregnant and parenting families, but that is what some of the policy that our organizations like Black Women for Wellness, California Black Women's Health Project, and others have been working to do throughout our city, state, and nationwide. Finally, I'll talk a little bit about Antelope Valley. Super excited about Antelope Valley because with the partnership of Charles Drew University, Black Maternal Health Center of Excellence, they were able to open up the first or the second maternal home in the city of Lancaster, which was a hub for Black families to access holistic and perinatal support and services, as well to work with some of the Black-led organizations there that are in our Antelope Valley AIM Community Action Team. Also allowed us to do an analysis of the landscape to expand the Black birth worker pipeline in that region, which we know is a little more rural. And so the services, we needed to assess what were some of the services needs out there. There's also an equity audit tool that has been developed to assess the non-Black leading organizations to assure anti-Blackness attitudes and behaviors do not prevent Black families from receiving services or participating in services that they offer. Further, excited about organizations like Project Joy and Empower Them Collective, who are our Antelope Valley AIM CAT backbone agencies, but they help to work with other Black-led member organizations to come together and raise funds, about $530,000 across those CAT member organizations to support in scaling birth equity work. Last slide. San Fernando and Santa Clarita Valleys, I got really excited about what was happening there when I went during Black Maternal Health Week to a brunch that was sponsored by our community action team there and Black Moms in the Valley. And it was wonderful to see over 40 women coming together to learn more about how their services and needs can be met as moms, as pregnant women, to really have conversation with them about some certain things like pelvic floor maintenance and different things that they were in need of, and support, and just encouraging them through this journey, but letting them know that we have these services like AIM, which they were very excited to be a part of, and so much so that they signed up on our websites and start sharing and posting and talking about how we can really engage and be involved. So we have Cocoa Moms, Black Moms in the Valley, as well as Mocha Moms, who are partnering with our community action team there. And so working now to not only build their relationships and partnerships, but work with hospitals and look at maternal health surveys, as well as identify some 2 priority areas for them, which is to engage with the hospitals for equitable quality access, but providing breastfeeding and postpartum support, and have begun engaging with Olive View Hospital, as well, looking back on some of the other partners like Northeast Valley, as well as they're led, and our backbone that leads them is the African American Leadership Organization. So we're excited about that, and actually their expansion into the church community as well. Finally, our last community action team is our San Gabriel Valley Community Action Team that has really worked to be a lead for our maternal mental health support for our families. And we were very excited the work they did during the pandemic to not only serve San Gabriel Valley, but to serve South LA moms and dads and those that were interested in receiving maternal mental health support, to demystify, destigmatize the need for mental health support, and to really address not just maternal mental health needs in those groups, but talk about losses, intimate partner violence, advocacy and effective communication with providers, and parenting support. And finally, with them, we've been able to start working on a landscape analysis through one of my interns from the Randall Lewis Health Policy Fellowship, who has worked to address where women are being served through San Gabriel Valley, because it stretches from Pasadena to Pomona. And so just looking at where are some of the best catchment areas, where are we missing, and doing some resource mapping. And those are some other things that we're going to effectively work on throughout all of the community action teams. So with that all said, we're excited to continue this partnership and commitment locally, statewide, and nationwide. Thank you. Pass it back to...
I think it's back to me.
It's back to you.
All right, thank you, Adjoa. And I'm going to move us quickly through this next slide so we can get to the overarching AIM learning. But the Village Fund is the other piece of the LA partnership that our funding is directly supporting. You can see here, important work underway. The first cohort, Village Fund cohort, has graduated. This fourth cohort just launched this last year, 28 grantees funded to date. You can see the impact on families reached and served through the Village Fund grantees. Kind of the unique thing to call out about it is this fund supports small Black-led organizations and individuals, and it's continuing, looking to launch a 5th cohort coming soon. And also, a lot of our resources are supporting capacity building. Adjoa spoke to a lot of that, but quarterly peer learning is happening for these grantee cohorts, focused on themes such as wellness and healing for Black women leaders, communications, digital strategy, and network building. And you can see here kind of the impact of that capacity building with the 80% reported increased understanding of Black and infant and maternal health disparities, 65% increase in expanding the type or quantity of services offered, an increase in collaboration among other Village Fund grantees through those learning, convening, and collaboration, and then increased collaboration with other AIM partners. Are important things to call out. Moving into fundraising and sustainability, beyond that capacity building, LA Partnership, they've played a major role in supporting the sustainability of this work. For the Village Fund, they have raised a total of $679,000. That's in complementing our $75,000 that First 5 LA contributes to the community grant making. So a ton of work has gone into funder engagement and advocacy and really building out that pooled fund. For the CATS, the LA Partnership has focused on supporting the CATS to build funder relationship, pursue smaller grant opportunities, gather donations, build their fundraising infrastructure. This last year, a development consultant was brought on, and continued advocacy. So highlighted here are some specific examples of sustainability-focused activities. There was a funder site visit organized in Antelope Valley, and continuing subsequent fundraising following that. There have been tools developed to more rapidly and easily support the pursuing of grants. And then in February, earlier this year, we co-hosted a funder convening DPH and First 5 LA with obviously LA Partnership, and that was really to engage a larger network of funders to support AIM's work and emphasize the importance of investing in its core infrastructure to move that work forward. The briefing was attended by over 20 funders, and follow-up engagement is currently underway. So now moving to kind of some key learnings across both CATS and the Village Fund. It has yielded several important learnings you can see summarized here. First one, community is critical. I'm hoping that has resonated or stands out to you. We often talk about systems change at First 5 LA, and usually that's focused on large government or public agencies in mind. But as we all know, community members with lived experience who bring the sharpest insights for how systems truly impact or fail to impact families must be a part of our systems change work. These same community members also have the best source of wisdom and innovative ideas on how we must change those same systems to better serve our families. And they also play an important role in holding us all accountable. And at the same time, backbone support is essential for supporting these community members to do this work. Community members to be active participants in the CATS. Support is needed particularly for the type of infrastructure building that will allow CATS to reach deeply into the broader communities and offer real-time support to Black families. Relatedly, a critical learning from this last year for the CATS, and think one that we here at First 5 LA can particularly relate to, as we are in the midst of our own strategic planning, is internal work takes a lot of time. All of AIM, including the CATS, had a heavy focus this past year on strategic planning and building organizational infrastructure that will continue to support AIM's work over the long term. And from both CATS and Village Fund, we've learned that peer learning opportunities provides vital spaces for organizations to collaborate, to grow their birth equity work across LA County. And while professional development trainings can offer important skill building opportunities when selected in partnership with community to ensure their relevance. Fifth, we learned that investing in community wisdom and core infrastructure is uncommon and essential, with First 5 LA's funding helping address what is often a gap in funding. I think many of us know how it is a lot easier to find funding and resources for programmatic focused work, but to find it for that general operating core infrastructure is incredibly challenging, and First 5 LA's resources have directly been able to support and fund that. And this brings us to our last learning. Sustainability is a team effort across our grant making. Often here at First 5 LA, we ask our partners to create a sustainability plan as part of their kind of grant making responsibilities or requirement, with an understanding they're looking and searching and identifying the off-ramp or how to sustain work past First 5 LA funding. And I know we're going to talk a lot about sustainability in the next item on the agenda. But with AIM, First 5 LA's role has not solely been as a funder, but also as a partner and an advocate. So sustainability has to be a joint team effort. So this means applying our own team's effort to identifying additional funding sources, leveraging our relationships with funders and public agencies to advocate for AIM and invite further investment, as I mentioned, from the Funders Forum earlier this year, and leading that briefing, and always working to amplify AIM's impact. So while this process is still very much in progress, we want to highlight it this year as another relevant learning as First 5 LA transitions away from being solely a funder to a thought partner, convener, advocate for the issues most affecting young children. So this next slide highlights kind of what's on the horizon for this next year. We talked about this year one, 24-25 is going to be the first full year of strategic implementation of our new strategic plan and the local action plans for the AIMS. There's going to be continued joint sustainability planning with LA Partnership, Department of Public Health, and First 5 LA, and those continuing ongoing capacity building efforts. For the Village Fund, continued support for cohorts 2 and 4, and then there'll be quarterly learning peer learning convenings. As I mentioned, that 5th cohort is going to launch using that equity-centered selection process, and that there'll be this continued management of the AIM Innovation Pooled Fund. So our proposed amendment and what's in front of you today and will be taken, ask for your action at our upcoming May board meeting, is really this amendment to the strategic partnership, and that is to extend it for an additional year through June of 2025, and to amend the total project budget for an additional $450,000. And it really is to then implement the AIM strategic plan and bring on additional funders, as we spoke to support the AIM core infrastructure, including the cat's bone, and to minimize disruption in service during this next transition year. So our last section, and so to kind of launch us into the conversation, we want to outline how the AIM work aligns with our new strategic plan. So you can see on this slide, these are the kind of 3 goals and the objectives that stand out for us, considering the work that AIM does. It certainly aligns with reducing infant mortality. AIM is focused on, as you heard throughout the presentation, promoting healthy and joyous births for Black families in LA County. So we clearly see alignment and contribution to that. It also is addressing increasing culturally affirming services and supports. We talked about Black women upfront and leading as a value of AIM, and it's certainly working across centering and supporting Black families, ensuring those services and supports are culturally responsive. And you can see some of the exact examples of the services: doulas, Village Fund grantees, education, fatherhood, as Ajwa talked about as well. And then finally, the attention to new mothers' mental health. AIM work certainly does that, as it's focused on reducing that continual stress reduction that it has on Black women's bodies, and it's done that also through a number of services through the doula program, and through Cherished Futures and many other efforts of the AIM initiative. And then finally, it's not noted here, but AIM, as you heard, is also addressing poverty through its Guaranteed Basic Income pilot, which both Dr. Franklin and Ajwa spoke to earlier. So where do we see as some emerging opportunities that we want to call out for you? We want to stay anchored in community. So to think about how do we continue to focus and support and invest in AIM core infrastructure. I think we've highlighted clearly how that is necessary and how it is challenging to find resources to do that. Continue supporting the CAT staff, the community navigators, and these additional special projects. We also want to focus on strengthening perinatal supports. Maternal mental health, as you heard, has become a growing priority and focus for the work. Continuing our healthcare system advocacy and quality, as the Cherished Futures effort ended in December, but thinking about what's the next stage and how do we continue that work focused on the healthcare system. Midwifery and birth centers, expanding and growing that work. And then, of course, policy and advocacy that can support women and girls of color. Mentioned through Dr. Franklin earlier about utilizing forgetting the name of the Robert Wood Johnson, thank you, funding, yay, to support the Crisis Response Fund that has been identified by steering committee and looking to implement that over the next year. And then, of course, continuing this support for basic needs for birthing families, greater focus on housing and rent subsidies, and to build on the learnings that come out of the Abundant Birth Guaranteed Basic Income effort that we spoke to earlier. All right, so overall takeaways. We are here. So 5 years is not enough to uproot systemic racism. I think Dr. Franklin made that very, very clear. A crisis which is centuries in the making will not be resolved in a few years. And over the past 5 years, AIM has been able to cultivate a strong foundation of partnerships, learning, infrastructure to support this work, seeing early impact on both families and systems. What is needed now is continued investment to expand the work, trusting leaders with lived experience to develop, refine, and grow innovative solutions to this birth disparity work. And lastly, an ongoing connection and co-ownership with community is essential for systems change to be successful. It must be rooted in the lived experience of communities most impacted by these systems. So before shifting to discussion, I do want to briefly pause and talk about this photo because it speaks to the heart of what we do. I have a very hard time talking about it. So the 2 girls shown here
You want me to do it?
are Divinity and Legacy, and they are the daughters of Bridget Cromer, a mother of 5 who died last year in childbirth while studying to become a nurse. Their dad gave permission to use the photo because it tells a story. And when we talk about preventing infant and maternal mortality, we are talking about real lives and families left behind. But creating an LA County where young girls and future moms can have the best pregnancy and parenting journey possible. So, thank you for listening today. We'd like to hear now from you and how we can continue to move this work forward. I feel like I should apologize for getting emotional, but I will not, because this is incredibly emotional work. So thank you, appreciate, I know it was a long presentation, and we have a lot to share, and you can hear the pride in our voices, but would love to hear from you on the next questions of how do we support this work going forward? How and what does our role look like in support of birth equity work? And given our strategic plan roles, convener, connector, thought partner, advocate, how can we at First 5 LA add the most value?
Can I
Commissioner
say
Hager.
something? I want to apologize to everybody, but I need to stand up. I have restless leg syndrome.
Please.
And both my grandmother and my mother died of it, so it's like I try to not suffer pain. I want you to know, thank you very much for this, it was amazing. The very first, I've been a commissioner for 5 years, and the first meeting, I don't know if you can remember this, that I came and I sat over in that corner and I didn't know the rules or regulations of anything in this room, I still don't, but I'll throw my heart into this. And the issue was raised about the death of black women when they give birth in this community. And we voted for $1.2 million to investigate this. Do you remember this? Yeah. That was the first time I was ever here. And I said, well, that's racism. The cause of it is racism. So it's amazing to see where you are. And I wanted to, there are a couple of comments I want to make of what I see from my perspective as being critical and moving forward. Number one, having women in the community advocating for other women, they become the navigators, they become the ambassadors for excellence and care. Equity is not equity, it's really access to excellence. And unless we acknowledge that, and that's why the death rates went down in Baltimore, is because they had access to excellence. They really focused on, so having doulas present to act as navigators and educators is critically important. I would really love to have an intense conversation with both of you about what I see as a pediatrician and the opportunities that are presented by this. Because for about 10 years, I've been talking about a Beyonce clinic. I mean, I don't know Beyonce, but South Central. But the idea, one that is focused on community-driven. This shows what a community can do when they're driven. Yeah. And mothers and babies are, critically important, and I wanted to do that. Now, I also would like all of them to receive training on talking to black pregnant women about never drinking, so we don't have an epidemic continuing in the African American population of fetal alcohol spectrum disorder. It's hard to say that, and I know people don't want to hear it, but they don't want to hear that any more than they wanted to hear that black women were dying in childbirth. All right? And when I look at the statistics of the kids that are incarcerated in foster care and go on to adult prisons, and look at the dominance of the African American population there, it's frightening to me, just like the death of women was frightening to me. I think that Deanne would probably join me in saying that having established that as what you've done is actually the best possible way to move forward to protect kids from being abused, neglected, or whatever. And I not this forum, but I'd love for First Five to address the issues of this incredibly destructive move towards non-reporting but supporting. I'd like to move into sustaining, not detaining. We have to rhyme. Let's rhyme something that has meaning, because without reporting, we will never know who needs us. It doesn't mean that the report has to mean that the kid is taken away, but so it's sustaining those families, and we really need to move in that direction. And, I have an article here if you want to read it, that shows kids that have the first report to DCFS, the high percentage of them that go on to be abused. And it's an opportunity to prevent that. And then finally, sustainability of doing this and the tremendous outcomes that you've demonstrated has to be put on that it's an entitlement. It was scary to me to hear about plans to raise more money. I'm into that. And I'd be happy to help do that. But it also should be something that medical plans and public health and private health and taxpayers should basically be funding. And so when you have a pregnant woman and you have a doula going out and acting as a navigator, that should put in place where it's billable, rather than us or you or a community begging for the righteousness to take care of their women and children. We shouldn't be begging. We should be entitled.
Thank you. Thank you.
I would also add that, what we look at is like, we were seeing individual stories, right? And we're also seeing services being provided. And then we ask the question, well, is that system change? And those are open doors to system change, right? Doula services that we have been providing resulted or contributed to Medi-Cal covering doula services, right? Very directly. And when we first started, we're like, that's not system, but we want to do it. Right, it's important. No one else is supporting our folks. And the other piece is the whole CalAIM reimbursement conversation. The fact that we have an activated AIM network opens the door for our community providers to be able to leverage that. We've launched ECM services in MCH and have begun the birth equity population of focus work and have some enrolled in that. And we're able to provide navigation support directly to our AIM network because we were already ready in doing that. So point well taken in terms of not begging for support or begging for financial support from funders, that there be a baseline investment in the well-being and that we are entitled to have access to, which is quality care.
Right, and my concern is, I think that what you're saying is the community knows how to advocate for the best quality for their individuals because they become smart and savvy as to who's not delivering it. And therefore, I mean, there's the good news and there's the bad news about Obamacare. Okay, that was that everybody got care, but the bad news is not everybody got quality care. And that's where the community activists really come in, is demanding quality care and knowing where to find it and directing that population there, candidly.
I want to say it right, Hager, Dr. Hager, thank you so much for sharing in your comments. Definitely agreed, and that is some of the work that we're doing through the community action teams, is building partnerships with like DCFS and working with DMH, but then also working with the healthcare providers to have the conversation between the doula, between the physician, between the nurse, so that is a strong pipeline of advocacy so that each could refer. We know that there are spaces where people will birth at home. We know that there are spaces where people will birth in the center, and people will go to the hospital. But we do want to ensure that people are able to go to places where they feel safe and comfortable, right? I mean, I don't know about many of you, but when I go to the doctor, I'm expecting them to deliver the most humane care to me as they would their own family member. I mean, I have talked with people recently about this. When we all leave here, we get to take nothing with us. At the end of the day, all that we have accumulated will not fit in that casket with us. It will not go into that incinerator or anything with us. It'll just be us by ourselves. And so if that is how we all go, then we all have the same experience in some form, shape, form, or fashion. And so when you're looking at being provided with care, you're entrusting that whoever has studied, whoever has gotten their licensure, that they know exactly what they're doing and that they're going to really care for me at their best. Those families, like looking at the picture of Divinity and Legacy, Divinity is the 1-year-old that Bridget never got to hold. Divinity is the one that she wanted to hold before she had no idea she was passing. But the best her husband could do, because of what the physician said, was to just go take a picture of the baby in the nursery and come back and show her that. When he left there, he had no idea he was leaving to go home with the other children to get a call or answer his messages in the morning and know that his wife had passed. So we're looking for the best provision of care as much as possible, and that we are the systems, and we are the system change agents that can make it happen by helping folks to learn how to advocate for themselves, switch providers, make complaints, do whatever is necessary to make sure that we effectively improve these outcomes that have become burdens on our system. Financial burdens, bigger than me coming to ask, or us coming to ask for the support. We have to look at, and one of our departments, who is that, under Anna's leadership, that can show forth the CMS, the negative, the birthing outcomes for those, and the cost for those with birth defects, long-term abnormalities, and how that has burdened our system. So we're working to intervene and prevent that.
Well, one of the things that, as a professor at a medical school, one of the things you're trying to get taught to physicians in training is empathy and what Carlos Santana calls contagious compassion. And that is something that's not taught. And that's my point, is that the community individuals that are advocating for the women and the children are the ones that have to insist on empathy and compassion. And it's a sad commentary on my profession that we aren't taught that, but we aren't. Not something that's important to many. Maybe we can talk a little bit afterwards about maybe coming in and sharing some of that with med students, because the idea of getting them started early to think about compassion might be important, because it's concerning to me.
Commissioner Segala?
What's exciting about this data is that you can share it with other groups of color as well. As a young mother, I had a stillbirth baby, and I almost lost my life, and it was again because of inadequate care, because I was in poverty. And so again, this data is not just important, and I don't want to minimize the value to the African American community, because certainly Black babies and mothers really need this services. But the outcomes that you give aren't going to change with other groups of color, I don't think. I mean, there'll be obviously cultural nuances and obviously cultural differences, but in general, just the compassion and the follow-through and the detailed really health history, and take a look at what can be done when both are still alive is important. So thank you for your important work.
Thank you. You're welcome. I would just add really quickly to that, though we have a focus on African Americans, it is still impacting all. So as we fix it for us, we fix it for all. The benefit of SB 65, for example, it doesn't just impact, with the doula services, it didn't just impact Black women, it impacted all who were receiving Medi-Cal. And so we're partnering with other organizations that we can still refer other women for doula services, and we can still partner with them to continue the work that they're doing and the trainings and the educations that serve all in our community and all throughout our county. So yes, absolutely. That is the work that we continue to do here, and even at the, when we talk about policy and advocacy, working with folks like Senator LaFonza Butler that just came and talked to us and now has a bill coming out that we'll share about just this, to ensure that, like, the Federal Momnibus Act goes forth, and that women are supported in their pregnancy and birthing journey.
Which benefits all groups, all people, all folks in our county. It's a whole system improvement. We're in MCH working on a project that's HRSA funded, we're not funded, with a university who is looking at how do you build these scenarios into their simulation programs for their students. It's really high-tech and for me, but I understand the equity rubric that we're building into it, which benefits all of the potential or future patients of, of their students.
I absolutely agree. Thank you.
Commissioners and presenters, my apologies for the interruption, but we were just informed by Zoom attendees that they're having a difficult time hearing some of the comments. So just a quick reminder to talk directly into your mic and have it in front of you no further than about 6 to 8 inches away. Thank you so much.
Commissioner McBride.
Hi, Alan. Thank you for this presentation and the ways that you are so committed to the work. I know this personally. It was in 2018 in this location that I was introduced to the work that was being done to address Black infant and maternal mortality. And from that day forward, I have tried my best to be as much of a partner in this that I could. And it's a big part of the reason why I'm sitting on this commission right now, because of the path that I was put on when I heard this information. And I was here as an alternate. I was working for a clinic, and the person who was supposed to be in this room was not able to attend, and I think that was, it was definitely meant to be. I just was taking notes during the presentation and reminded of so many ways that the work that you're doing aligns so closely with the goals that we have been talking about for months in this space about concerning the new strategic plan and ways that we want to find ways to amplify the voices and produce solutions that are coming from and most closely connected to the people who are most impacted. And that's exactly what you're doing. I also, just as you were talking, made some notes because I have to sort of contain my excitement for the program, my emotions when it comes to this topic. And so I actually really appreciate the realness, because we're not talking about numbers or statistics, we're talking about people and families and lives. But just the way that AIM is collaborating across sectors really set an example of how that can be done when you're working with public and private and community-based organizations and individuals. Anyone can join the work. The model that you've designed allows for anyone who learns about this, even someone hearing about this today, can come to our the next regional meeting and get involved. And that's really the goal of anyone that wants to see change that's at the root, that's touching the lives most impacted. And it's also the way that AIM addresses the social determinants. You've already listed it, but the initiatives addressing the wealth gap, physical, mental health, emotional wellness, community building, policy, even material support to families. I don't know of any other connector to resources. And navigation is existing in LA County in the Black reproductive space. And that's not to belittle the other organizations that are doing this work, but the way AIM brings together even those organizations, there's no competition. It's actually the role of a navigator to bring these organizations and individuals together so families know how to get the best care, because there's no need to compete. We actually need more resources in this space. Right. But also, I appreciate the graph, but also some of this can't be captured in a graph. It's in the personal stories and the lived experiences of the people who will come to a meeting. I do a NICU support group for Black families through Open Paths Counseling Center, and two of our participants found out about us through attending like a virtuality or something with the AIMCAT. And so this connection is really being felt in the community, and that's something that can't really be captured in a graph. I also have learned through the AIMCAT, so much more than I ever knew about the rise and fall of midwifery and the resurgence of midwifery in the Black space, which is so critical to creating spaces Black families can trust in their birthing journey. Especially, we talk a lot about food deserts, but we don't talk enough about the healthcare deserts. If you do a Google search on a map for West LA, you'll find like 40 OBs and 10 square miles. But if you're living in South LA, maybe you can get to SC or California MLK, but now more and more services are being cut off, and neighborhoods, I think LA County has the third largest population of Black people in the nation. And at the same time, we have the highest rates of Black infant maternal mortality, some of the highest rates of mental health, and even to the point of, fetal alcohol syndrome. There's a connection to that with racism and self-medication, and that needs to be acknowledged too. We have to get to the root cause of why families are suffering and needing these additional supports, and I think the model that the AIM has established brings together so many of our values, and one that comes to mind is our overarching value in our strategic plan, equity. We honor the wisdom of the communities, recognizing their assets, hold the key to dismantling systemic barriers and forging a path to racial justice as we champion opportunities for all. And for me, this is what AIM does. And so I just want to personally thank you for this. Like I said, when you broke down, I didn't want to speak first because I knew that having had the realization that I am not only someone who is working in this space, but it wasn't until after that 2018 meeting and I learned all of these statistics and I went home and started talking to my husband and he mentioned our son's name, our second son, Parker. He said, yeah, that's Parker. For those of you who don't know, I have 5 sons. My second son, who's now 18, was in the NICU for a month because the nurse refused to listen to me when I told her my water broke. And we have excellent health care. My husband has excellent private insurance. We were delivering at UCLA in Santa Monica. I had one OB deliver all 5 of my babies, which is really unheard of and such a privilege. But the nurse in the labor and delivery department 18 years ago didn't listen to me when I said my water broke. And I went into labor a week later and had to have an emergency C-section, and my child almost died. Fortunately, he is a healthy, thriving 18-year-old who's on his way to college now. But I didn't even realize that when it happened. I thought it was something wrong with me. I thought there was something wrong with my body. I thought there was something wrong with, the way I cared for myself during pregnancy. And it wasn't until I learned so much through the AIM initiative that my husband was able to make that connection. And so you have so many families out there that are struggling to advocate for themselves because so much of what Black folks experience in this country is this notion that we are our own worst enemies. So much of what happens, poverty, is because of a lack of willingness to work, which is the exact opposite if you actually look at the data. So I just really want to thank you for being here, for presenting this information today, and express my gratitude to First 5 LA for being a partner in this, because it really truly aligns with so much of what we have talked about is our mission as the largest funder of services for families 0 to 5.
Thank you. Thank you. I think I couldn't agree more, Summer, Commissioner McBride. With First 5's partnership and real allyship from some of our colleagues, and you see some in the shirt that says support, protect, believe Black women, is just what Summer said, is that is what is happening a lot of times. And you think 18 years ago, if I said my water broke, I know the difference between urinating and water breaking.
Yeah.
And so, but, sadly, this is what is happening often too frequently. I'm dealing with a 17-year-old. I'm just sitting here reflecting, and I'm trying to get her just to get into the programs because she's pregnant. And at 7 months, it was hardly showing. But she was brought to me by some gang interventionists because her lifestyle is a foster youth and in the communities that she's raised in, and like you're talking about with alcoholism, you have to look at our communities that are either food deserts or that are constantly, we're over stimulated in a sense with liquor stores on every corner. So, and then it's popularized, it's cute, so supposedly, to drink, but then we find out it has no real benefit. But it's late in the game when folks find that out. And so, again, what we're doing and what you shared in AIM, working with Cinemoms and working with even some of the small organizations that just even some of the AIM Village Fund grantees that were just providing yoga or dance, but now they're building their business and now they're going from folks becoming doulas to deciding to become midwives. It's empowered, it's important, it's imperative, so you're right. When you first heard the conversation in 2018, look at where we are now, but look at where we can be with the continued partnership and the support for our communities. Thank you.
So, actually, I was reflecting on what you were saying, Commissioner McBride, and I think every single page of the presentation, I was making notes, trying to figure out how we at Department of Mental Health can be a better partner in this work. And so for me, I wrote notes here, I wrote notes here. I put a bunch of action items to follow up. I'm super appreciative of the presentation and the work you're doing. I think that it hits a sweet spot, not just for First Five's work, but also for the work we're trying to stand up within our department, especially around prioritizing services for children and youth. So thank you very much. And congratulations on your grant from the Robert Wood
Thank you.
Johnson Foundation. Yep.
I want to thank Commissioner McBride for sharing your story and making this really real for us. And for the architects, we talk a lot about systems change, and I think about the sort of systems creation you all have done in LA County that is completely unimaginable. We assume that systems should continue to work in a certain way, but what you all are naming are services and creations and relationships and networks that simply did not exist in LA County. So a lot of appreciation for that, and I really appreciated hearing the 2018, here's what's happened, and the strategic planning that's happening now for what it will look like. So two questions for you all on, as you're looking ahead for the systems creation that's needed in this area of work, what would you share with the commission here? One, on how you selected the CATs and the communities themselves, your thinking, how that was shaped, because honestly, we often talk about working in Santa Clarita and San Fernando Valley, and we don't talk about Black communities in that area, and a lot of folks say we have not been able to find connection. So really curious on how you selected CATS communities. And then the second, if you could help us on the narrative shift. Dr. Franklin, you talked a lot about getting information out. The narrative shift, you described what's happened. How do we envision a sort of 2.0 version on narrative shift now that at least there's some conversations about this happening?
I'll start with the cats. So with the cats, quite honestly, when we were looking at the data, there's a number of things. So we knew the state had not provided us with data on, Black women as it related to birthing and pregnancy outcomes. So for now it's 30 years, but back it was almost 30 years then. So bringing folks together based upon the data that we had. The data that we had said that the highest rates of Black infant mortality were in SPAs 1, 6, and 8. So we were initially focused there. But having folks like, I'll call her out, Marlene Rolette from San Fernando Valley, who I worked with years ago when they first had the BIH program through Mission City Community Network. She would not let it die that we had, county had taken that, felt like county had taken that money away for their BIH program, and they didn't have it. And she said, we still got women out here in the valley. We still got Black mamas out here in the valley that need these services. And so when I started with the first South LA, South Bay AIM-CAT, I went around to everybody that I practically knew. I'm taking flyers, I'm talking to people, I'm telling, that's how even getting to summer, working with at the reproductive annual conference for Black Women for Wellness, telling everybody, we're going to start a community action team. Let me know if you're interested. Going to Kaiser and saying, hey, to Celia Brookman, who was the program, one of the community program managers, hey, can Kaiser be a part of this? Are you interested? And when we had that first conversation, I think we shocked county partners and leaders, because the room was filled with over 100 people. And there was standing room only, and we had to tell people there's no room because this room capacity at their Baldwin Hills location filled this. And so we had grandmothers, we had grandfathers, we had I remember a gentleman worked for Friends Outside, which is an anti-recidivism organization. And he ended up calling me later and saying, I had to go to my children's mother and apologize to her for what I didn't know. He said, I went home and I cried because I didn't know that this was happening to Black women or our infants. I had, Dr. Lurvy there at West LA. He came up to help me with the slides because we had to first start out with the racial history, right? What has happened to Black folks in America, and then bring us up to speed and talk about Dr. J. Marion Sims, who worked on Anarcha Lucy Betsy, where there was anesthesia, did not perform that. Over 30 surgeries on those Black women with no anesthesia because they were slave women. Though he was working to create things like the speculum and working on a specific surgical procedure, he was doing it in a traumatizing way. And so we had to have those type of conversations, bringing physicians and doulas and midwives and anyone who was interested to the conversation. So that's how we started with the CAP model. And then because of whole person care and having the funding that they provided positions in SPAS 1 and 2 and 3 and 4 and 5 and 6 and 7, we were able to get some of the team members there, and they said, hey, we want to have a cat in our area too. So it was just 1, 6, and 8 at first, which was Antelope Valley and South LA, South Bay, and then San Fernando and Santa Clarita. They were like on Dr. Allen at the time. And we said, let's go. And so we had folks there in those communities and other county leaders who said, yeah, it's impacted here. And then when we got the data again, guess what the data said? SPA 7 had high rates, almost as high and getting as high as 6 and 8. And 2 was high, and 3 was even high. And so the data showed that wherever Black people reside, Black women and infants reside, is where the needs are, and they're dying in those areas. And so, but we have to realize data can come late. So what do we do while we're waiting for data? We have to continue to serve and build these provisions. So Commissioner Byrd, thank you, because DMH has been a partner from the onset. Some of your staff at DMH have really partnered with us in this work, and I continue to. We're able to work with a number of the ones at various sites in the community, like MLK and AV, to expand our maternal mental health work, to support the GBI program. And so back to you, President and Commissioner, how that is how we got the CATs going into those areas and continually bringing. We have Huntington Hospital that is ready to jump on board with San Gabriel Valley, as well as the various hospitals in San Fernando and Santa Clarita. Everybody's ready to be a part of this work. How do we do that and continue the efforts?
Yeah, there is this critical mass from that, and folks opted in. They wanted to see it change in their service planning area. So we figured out how to get some funding to support it and leverage what reaches countywide, which is communications, messaging, policy change. And then as it relates to changing the narrative, it really came from speaking with the people. The feedback that we got early on in the work was that all the stories about maternal deaths and folks losing their babies really was causing the Black pregnant women, individuals we came across, to feel so fearful of having a baby, or fearful of even becoming pregnant, fearing that they would lose their baby or they would die in the process. And, we just, felt that was such an injustice, and had determined, in working with the steering committee and committee action teams, developed what would be the messaging that we would land on, which is around healthy and joyous births, that just surviving one's birth experience was like bare minimum, right? That thriving was the end goal and the outcome that we would point people to. And then in terms of how to rally folks around that, the focus, again, came out of the community. That it takes a village, and we just leveraged that, identifying that we all have a place in the work, and first seeing ourselves as part of the village, being clear about what the root causes are, that we're not trying to transform the behavior of folks, but we're trying to change the behavioral system, and getting the systems to understand that they're part of the village too, and what does it look like to be a member of the village? It looks like respect, it looks like dignity, upliftment, joy, abundance, community, well-being, and that really has been our framing. I would say looking forward, and would love to hear from you all, my colleagues as well. What is our framing? It really is anchoring the village in those things that still stand as a barrier between achieving healthy and joyous births. Our healthcare system, which is big, right? How it's structured right now, which is not, no one's happy in it, providers included. The other is housing, which is at the top of the list next to mental health. Those are two big questions that we really all need to collectively figure out how to address. Pregnant folks are not prioritized in our rapid housing and homeless shelter support services system. They're not. There's no formula that places pregnant folks at the top of that list, and we believe that it should be. And as it relates to AIM, Black folks being disparately experiencing homelessness in our county, we see that as a direct connection. And the other is mental health services. We're currently advocating with our national and state partners as it relates to home visiting to be able to provide direct mental health services in our home visiting programs. Our guaranteed income pilot, thanks to funding from DMH, has abundant birth coaches. Those are individuals who lock arms with stipend recipients along their pregnancy journey with the goal of reducing stress and economic burden and the stress that causes by it. So that really is our kind of looking ahead, is anchoring the village with those big issues, those big questions that really having a system be in solidarity with community would be a game changer for what we would see as outcomes of joy and abundance for our families. Systems can be in solidarity, right? We can have solidarity, yeah.
Yes. So I think we need to take a break, but I just want to check on the urgency. Do we do public comment first? Are there any
We would
public
do
comments?
public comments first before we go on to the next item.
Thank you again, very much.
Thank you.
Ms. Bowe, are there any public comments?
Yes, they are public comments for this item. We have a couple on Zoom. The first one will be Jacqueline Jones, and your item will begin now. You'll be given the ability to speak, Ms. Jones.
Hi, this is Jacqueline Chun. Good afternoon, Commissioners. This is Jacqueline Chun with the Carl and Roberta Deutsch Foundation. I'm the Chief Programs and Operations Officer at the Foundation. The Deutsch Foundation encourages First 5 LA to continue its support of the AIM initiative through ongoing financial investment. The Foundation's mission is to build healthy communities in Los Angeles County. The Foundation's journey in learning about the persistent disparities in birth outcomes of African American babies and mothers in comparison to other race and ethnic groups began in 2019. The data spoke volumes and could not be overlooked. The Foundation began its support of the AIM initiative in 2020, the timing of which dovetailed with the COVID-19 health pandemic and the nation's racial reckoning. What surfaced for the nation from these co-occurring crises was that they were not happening in isolation of each other, rather in direct correlation. Since its inception in 2018, the AIM initiative has lifted up exactly this, the relationship between race and health outcomes. African American babies and mothers are dying because of their race, and this is simply unacceptable. In recognizing that the disparity in birth outcomes of Black infants and mothers is uniquely theirs and racially driven, the AIM initiative is addressing deep-seated systemic and social issues. Its partnership with Black communities across LA County empowers those most affected to co-create solutions and make decisions on what is best for their communities and what resources go and to where. This is a public health crisis that we are responsible for addressing. We know the contributing factors. We know that the solutions require embedding racial justice and inclusion in our public health systems. Too many families have experienced unspeakable loss and continue to do so. We are severely behind in this work, but it's important to look forward to what we can do in the future. To address the generational years of harm to Black communities and realize long-term sustained change that builds on the positive ground made by this initiative, there requires ongoing investments through leverage and direct resources from public and private partners. Thank you.
Thank you so much, Ms. Chen. My apologies again for stating your name incorrectly. Our next public comment speaker is Jennifer Roberson. Jennifer, you do now have the floor.
Thank you so much. Good afternoon. I work for Breastfeed LA, a breastfeeding organization, and a breastfeeding advocacy organization. And we have worked closely with the AIM community action teams and the Village Fund, along with First Five, especially in the South region of Los Angeles since its inception. And this past year, we worked with the South LA South Bay Family-Centered Models of Care Work Group to engage with Black-owned businesses to normalize breastfeeding in public spaces through the Breastfeeding Safe Spaces campaign. Breastfeed LA also received a Village Fund grant to provide a breastfeeding support group which centers Black families in Carson and surrounding areas. The support group is run by our clinical director, Alia Shade, and myself, Jennifer Roberson, as the program coordinator. By providing lactation support by community members for community members, we have built trust and a growing and thriving support group community. And to date, we have served over 150 families through the support group and lactation clinic. And more recently, we received funding to provide outreach towards the Guaranteed Basic Income through the California Abundant Birth Project. And not only are we grateful to be part of this important work, this work has enabled us to provide workforce development to the moms in our programs who are now outreach workers to increase awareness, as well as assist mothers with completing the application process. The work being done by the CATS, the Village Fund, and AIM is essential for supporting pregnant and parenting families, connecting people around this important work, and most importantly, saving lives of moms and birthing people and babies. As we all know, funding for maternal and child health is limited, and First Five LA's investment in this important issue has and continues to make a real difference. Thank you for your time.
Thank you so much, Ms. Roberson, and that does conclude our public comments for this item.
So we're going to move on to the next item, which is a break. So we're going to take a 10-minute break. It's 3:08. Let's try to get, a 5-minute break, sorry. 3:08. Let's be back here at 3:13.
Yes, we will be returning at 3:13. Thank you so much.
Thank you.
Thank you. Because of honestly the work that's being done, allow families to know that like there's a system that's at fault. Like it was a lot harder when it was like that guilt of what did I do wrong, and I know there are so many families of all races that struggle with feeling like I did something wrong when my baby ends up NICU or doesn't survive. I mean, birthing is so hard. Like it's something that happens. It's so natural. It happens every day all over the world, but it's hard. Yeah. Right? and it's harder even after like the fact like the baby is here and you're still recovering. Right. Yeah. Right.
is on First 5 LA's programmatic sustainability strategies. I'm going to hand it over to John Wagner to kick us off.
Thank you, Commissioner. And recognizing we're a little behind on the agenda, I will just summarize some of the remarks I was going to make on this item. So the key points in getting into the next item on sustainability is our fiscal context and the fiscal reality. And though we have, and the board is well aware of our declining revenues, which were anticipated given our main funding stream, it's important to see the connection across several of the items we're bringing forward on today's agenda. So we just heard a lot about the important work in partnership with a system partner, in this case, the Department of Public Health, and how funders came together to pool funding to support the AIM work, the critical work of AIM. And it allowed us to do work in ways that were well beyond what just First 5 LA could do alone. We're about to get into an item on sustainability focused more on home visitation. Home visiting, specifically Welcome Baby and Select Home Visiting, we refer to it, is the single largest investment in our budget. And so we're going to talk a little bit about staff work and some opportunities, including tapping into entitlement programs that could fund this work, and acknowledge the partnership we have with DMH in this area. And then the next couple of items on the agenda include the Equity Index, which is bringing forward some very early and very initial thinking on ways in which we might think about targeting resources, knowing that our resources are declining. How best do we target resources in a way that addresses those furthest from opportunity? And we will wrap up at with the last item, acknowledging the role that policy and advocacy can play in advancing our work. And keeping the fact that although our revenues may be going down, we want to maintain the impact that First 5 LA can continue to have on the lives of kids and families. So with that, we're going to get into this presentation. And do you want me to start it? And as I mentioned, we will be talking a little bit about the early initial successes on ways in which we have leveraged other resources to move First 5 LA's programmatic investment in Welcome Baby, Select Home Visiting forward. And we will dig into that a little bit more. My colleague Deanna Cariaga is head of our family supports team and has done a lot of the important work in that. So we'll be drilling down a lot into home visiting, but it does include opportunities across a lot of the other work we do here at First 5, including in the health arena. So this is what we refer to as our sustainability framework, and this was introduced to the board. This isn't the first time you've seen it. In fact, our Vice President of Operations and Sustainability, J.R. Nino, has shared this in previous board presentations, and it's really looking at what assets First 5 LA has and how do we maximize those assets, including things like the building, but also the investments that we're currently making in some of our programmatic areas. And this is an example of where we will be getting into further in the following slides. And you'll also note the other areas of sustainability in our framework, including policy advocacy and collective impact, which again is an example well illustrated by AIM, where different funders were coming together, pooling resources to move a body of work forward. So just to connect it to the sustainability framework. And with that, I will turn it over to my colleague, Deanna.
Thank you, John. Good afternoon, everyone. So I'm going to begin with the broader context of sustainability opportunities. As you know, there's an increasing focus at the local, state, and federal level on shifting funding streams towards primary prevention, towards and promotion of child and family well-being. So I wanted to call out a few examples you may know of. So we have the LA County Prevention and Promotion Systems Governing Committee, which has a 0 to 5 focus. The Family First Prevention Services Act, or FFPSA, you will hear that acronym a lot today. It's a federal funding that's shifting funds from a focus to children in out-of-home care to those at risk of entering the child welfare system. There's the FFPS block grant funding, which covers programming that is not allowed under the federal FFPSA. And finally, the state's Medicaid program, or Medi-Cal, which is working to transform the public health care system with a focus on the social determinants of health and equity. So the increasing focus on more upstream prevention translates into a focus on these two major federal funding streams, FFPSA and Medi-Cal. So while they're separate programs, there are many commonalities that are important to keep in mind as considerations for First 5LA. So both can pay for some activities, but not all, and FFPSA is the true payer of last resort. So if Medi-Cal covers an activity, it's not covered by FFPSA. Both would require upfront funding from many community-based organizations, as these are reimbursement-based funding streams. And additionally, both reimburse for only 50% of the cost of services, so a match is needed. And finally, there's additional infrastructure that's likely needed to support the process of drawing down the funds. So this could be a claiming system or collection of additional data elements or even staff to fulfill administrative duties. So First 5LA has undertaken extensive exploration of these two strategies as a means to either offset or reduce First 5LA expenditures across programmatic areas. So the examples on the slide are just a few that we selected for this presentation, so they do not represent the entirety of what we have explored or are working on. So examples here include the Medi-Cal doula benefit, which may help sustain the African American Infant Mortality, or AIM initiative. Do all this listen to? FFPS funds, which are being used to test how to draw down funds through pilots currently in SPAs 2 and 6 that are creating referral pathways to eligible programming, such as home visiting. And we're exploring how the Community Health Worker Benefit, or CHW, can bill for Help Me Grow staff activities. So we did want to call out a number of successes that we've had across our programmatic areas and our sustainability work so far. So we've mentioned we've been able to successfully partner with DMH for prevention and early intervention funds for home visiting for a 3-year contract. We secured a contract with Blue Shield Promise Health Plan for home visiting. We have an ongoing commitment from system partners to continue funding Help Me Grow. And finally, to go back in time a bit, we did partner with DPSS for a home visiting pilot back in 2017. With phenomenal results, which influenced the state to begin funding CalWORKs home visiting in California, which continues to this day. So there have been great opportunities and wins across multiple programmatic areas with our efforts around sustainability strategies. What we wanted to do is shift now and take a deep dive into home visiting, given, as John said, it is the largest direct service investment for First 5LA. So we may have seen this slide before. This is an overview of the home visiting landscape by funding stream in LA County for this fiscal year, 23-24. It shows the county-wide investment of $96 million. It spans 6 program models and 9 funding sources, 5 of which are administered by Department of Public Health. In 2018, First 5LA funded more than half the services, but due to successful advocacy efforts and increased state funding for home visiting, DPH now administers the majority of the funding at 49%. For First 5LA, home visiting still remains our largest direct service investment at $32.5 million. That's 33% of the total. Although I did want to call out on the slide that the DMH funding of 5% is passed through First 5LA. So what happens if we continue at status quo? So what does status quo mean? It means that we would have no sustainability strategies. So there would be no DMH funding for home visiting, no engagement with health plans, no Medi-Cal, no FFPSA, and funding all 3 of our current program models, Welcome Baby, Healthy Families America, and Parents as Teachers, represents 25 organizations, including hospitals and community-based organizations. That is the status quo. And in case you're wondering, the dip in funding there represents the strategic reductions that we undertook in this fiscal year. It does represent about 61% of that dip was removing vacant positions from grants. And there was some Welcome Baby right-sizing and staffing adjustments. So without any offset or reimbursements, the projected budget would reach $32.9 million by fiscal year 26-27. That annual increase is largely due to workforce compensation. And given First 5 LA's fiscal reality, the status quo of funding the same scale or the same level of services for the three models is not sustainable over time. So, given that we cannot maintain that same level or scale, staff has been undertaking a strategic analysis with two key questions. What is First 5 LA's role and contribution to the countywide system of home visiting? And given what we currently know about sustainability strategies and their timelines, how can we best align to First 5 LA's sustainability planning efforts? So the question of what we currently know about these strategies takes us to potential opportunities. So in 2021, we leveraged funding from Heising Simons Foundation to commission a fiscal mapping project for home visiting in LA County. We worked with a national expert and consultant, Kay Johnson, who facilitated a county-wide process that included research on possible funding sources for home visiting and interviews with stakeholders across the system. So the resulting report recommended 2 federal entitlement programs that could potentially fund home visiting, which I highlighted earlier, FFPSA and managed care plans and Medi-Cal. Based on analysis from this report and local partners, there was a great potential in these strategies for home visiting, and we've done extensive exploration and work in these areas. So to dig in to these 2 opportunities in the context of home visiting, for FFPSA, the state included 3 evidence-based home visiting models in its now approved prevention plan to the federal government. And that includes 2 plans that First 5 LA funds, Healthy Families America and Parents as Teachers. This means that these services would be eligible for a 50% reimbursement when provided to eligible children. The state also included motivational interviewing as an evidence-based practice that is eligible for reimbursement, and home visitors in our Welcome Baby programs are already using this practice, so we have an additional opportunity to explore how to draw down funds for that program. And finally, based on the information provided to date by the state, our understanding is that the majority of children already enrolled in our home visiting programs would qualify for FFPSA funding. So looking at Medi-Cal now, as you may know, there are transformative efforts underway by the state, led by the Department of Healthcare Services and Medi-Cal managed care plans. Under Medi-Cal, we see commonalities between some of the activities of home visitors and community health workers, or CHWs, and CHWs are now a Medi-Cal eligible provider population. We also see significant alignment between the measures for which Medi-Cal managed care plans are accountable for and the data we have on the outcomes for home visiting clients, which far exceed what is being reached in statewide quality measures. So as 3 quick examples, more than 90% of children in home visiting for First 5 LA funded programs attend their well child visit. It's 90%. The statewide rate is 37%. 98% in home visiting receive a developmental screening compared to 30% statewide. And over 90% of parents in home visiting report their children being up to date on immunizations, and that's 35% statewide. So we definitely exceed many of the measures that matter to Medi-Cal, to managed care plans. We feel that Medi-Cal holds a lot of promise, and we are also seeing and hearing from others that the current reimbursement rates proposed by the state for providers, such as community health workers, is relatively low. So additional advocacy is needed, and additional infrastructure could be needed to draw down that funding. We have continued to explore other opportunities beyond Medi-Cal and FFPSA as well, and these come with their own considerations. So we continue to analyze each opportunity to determine what appears to be the most fruitful or most likely to advance sustainability strategies for First 5 LA and countywide home visiting. So some examples include McV, maternal, infant, and early childhood home visiting. That funding is being increased this coming fiscal year. First 5 LA does not administer McV funding, but we are coordinating with DPH to explore and support sustainability strategies that benefit home visiting countywide. We continue to monitor other opportunities as some may or may not be a good fit. So as an example, the State Children and Youth Behavioral Health Initiative did include funding for home visiting. However, the funding was for startup or expansion of services. And therefore, First 5 LA chose not to apply, given that we are not currently in a position to start up or expand services given our fiscal reality. We also support and are involved in coordination efforts for FFPS pilots in SPAS 2 and 6 and referral pathways, as I mentioned previously. And we remain in communication with DMH as we all continue to learn about the impact of the passage of Prop 1. So these are the key considerations under each of these sustainability strategies for home visiting. So for our work with DMH, the passage of Prop 1 will shift the funding categories for the Mental Health Services Act and impact the current contract for home visiting, and we're still assessing what this could mean. For FFPSA, the reimbursement rate for home visiting is still unknown, and the launch has been delayed various times and is currently anticipated for fall 2026. We also do not know the motivational interviewing reimbursement rate. For Medi-Cal services, we are leveraging First 5 California home visiting grant funding to implement a pilot to learn more about how to draw down CHW funds. However, we know, as I said, that the state reimbursement rate is low and additional discussions and negotiations would be needed with local health plans. And finally, we continue to explore opportunities given the changes in Medi-Cal. I'm getting to the key takeaway, which is applying what we know right now about timelines and reimbursements for FFPSA, community health worker benefit, and health plan engagement. Our conservative estimates show that in fiscal year 27-28, we would be able to reduce home visiting expenditures by only $6.6 million, leaving First 5LA with a cost of $27 million, which, as you know, sustainability strategies can only take us so far. And given declining revenue, it will still be necessary to significantly reduce the scale of First 5LA's investment, which will impact service levels. So for this year, the goal of staff is to develop a plan to align the scale of the home visiting investment to sustainability planning with clear guardrails. So as an example of a guardrail, staff identified that once First 5LA is living within its means, 15 to 25% of annual revenue will be spent on direct services, and any additional costs will need to be offset by sustainability strategies. Many factors are being taken into consideration in these planning efforts, including what are the available sustainability strategies per program model, the impact of those strategies to offset or reduce First 5LA expenditures, the availability of home visiting data to inform countywide efforts, and geographic considerations. So in closing, while programmatic, we know the scale of direct services and programmatic investments must be reduced in light of the fiscal reality, but First 5LA can still achieve a positive impact with its focus on systems change, policy change, and community engagement. And as we have moved into development of tactics for the strategic plan this year, we will be assessing the roles and activities that best maximize impact, with a few possible examples called out on the slides. And as we know, home visiting touches multiple objectives and goals within the strategic plan. That brings us to our ending, our questions for you. If there are any clarifying questions you may have, and what are important considerations in scaling down direct services to reach alignment to the long-term fiscal realities? Thank you.
Thank you, and I do apologize for the having to truncate your presentation. Any questions from the commissioners?
Does green mean on or off?
On.
On. So it's been on this whole time while I've been sniffling over here loudly. Thank you so much. As you know, I'm really invested in this issue and in home visiting. And so I have a little bit of knowledge about what you're up against, and I do understand that I appreciate that we have had this major investment, and I understand that it's a little bit of a problem now with the diminishing resources. I just want to know, can we, even with our issues here with diminishing funding, still continue to take a look at home visiting for the high-risk families? I've said this 100 times, but when we review 1,000 child death cases and find that only 2 had a home visitor, and if you then see that most of these deaths were babies and toddlers, then in my mind, I'm thinking, why wasn't there somebody in that home? I also realize it's a challenge because home visitors don't always want to go into high-risk situations, but they aren't always violently high risk. They're just, a stressful environment. There's isolation, there's loneliness, there's, sometimes domestic violence, sometimes there's just an incredibly overstressed single parent. That horrible case of the woman who killed all 3 of her little kids, nobody ever went inside her condominium. Nobody, people on either side of her neighbors had things to say about what they thought they observed. Not one of them knocked on the door. So in my mind, I'm thinking, oh, I wish there'd been a home visitor in there. So I guess I'm asking, is that something we can continue to keep on the burner?
I think one of the values of home visiting, regardless of the model, is that it connects families to resources and it has a pair of eyes in the home where other professionals cannot go.
Right.
So we're definitely looking, and it's really taking a county-wide perspective. There's many programs, and it's how do we have a way to connect families to whatever program can best meet their needs. And that's part of the value of having a network and partnerships between First 5 LA and DPH and other home visiting program models. So we're definitely looking at how to support families and fit them where they have the most needs.
Right, and I'm really pleased about that. I'm just wondering if maybe some of the information we have about the families where there was a tragic outcome, and again, they're all infants and toddlers, not all, almost all, sometimes several in one family. So I'm just trying to think if maybe we can inform what we're doing with a little more of what was happening in that household. Where could we have gotten? What information wasn't shared from the hospital? What information should have been advised with DCFS? Most of them didn't really have DCFS involvement, frankly. So it would have been probably the hospital that would have had the most information. And of course, we know about postpartum depression and psychosis and all of that. So that I'm just trying to make sure that stays sort of at the top of the stack of priorities with home visiting. So thanks.
Other questions, comments? So, I made some notes for me as a follow-up item, and DMH is willing to partner with First 5 and DPH on looking at how do we map what's going to be coming out of the Prop 1 work groups that are starting at the state. So if you haven't joined a work group, a stakeholder work group for the, I'm just saying, there's a state website you can go to about the Behavioral Health Services Act, and they are starting their stakeholder work groups, and their birth to 5 services are called out specifically within the Behavioral Health Services Act. So there will be stakeholder opportunities for feedback and to help guide services and direction. So I do think that there's opportunities coming. But as I said earlier, this is a priority for our department to stand up our services for children, youth, and families. Also a priority for the county, as your president and CEO is aware. So I think there's momentum here to do some exploration. So partner with us. Please, Commissioner.
Yeah, thanks. It took me a second to process my thoughts, and I'm not quite sure that I've quite done that, but I will share some things that initially come to mind. And I appreciate that you mentioned the county, because I know at the policy roundtable, part of what we are working on is, how are we better linking systems so that we're all talking with each other, right? Because as you mentioned, part of this is just people don't know resources exist or have the ability to get to them. And so I do think that, messaging about options and ensuring that if I go to one place that I get access to an array of other options and connections, and really thinking about how are we linking the system in a way that hopefully makes it easier for people who need services, right?
as well as ensuring that our staff who are in this system know about these other services, because I think that that's definitely another piece, is that we don't, not just do we not always talk to each other, but I don't think we always know of what is happening. And we're realizing that, I think, more and more. But my other question, or kind of my other thought, was looking at kind of these options. What do you think, or what do you anticipate is the timeline? Because some of them are still a little bit kind of up in the air, right? And so this is not a tomorrow switch, right? And so just curious about, your thoughts on timeline. I think all of your options are going to have a different timeline, but just generally curious. I think generally would say we'd probably come closer to knowing more by the fall. So we definitely would want to keep our partners, our grantees, aware and connected to what is happening or what decisions may come down the pipeline. So definitely be digging into this during this calendar year.
And I think I would just add, I appreciate your comment and your, as well, Commissioner Byrd, on partnering with the county. I think, as Deanna mentioned, these are all different timelines, and FFPSA is an example where the state needs to have certain things in place in order to begin to start claiming federal revenues. And the things that need to be in place are probably a few years away. Right now, we have the benefit of a state block grant. But given the fiscal situation with the state, it's not a guarantee that that will continue indefinitely. So I think we're looking at all of those kinds of realities that it might impact sustainability. The other thing, getting to your point about partnering with the county, is we didn't focus on this a lot, but Deanna's example of how this investment informed the state's decision to fund CalWORKs is a really good example, where now in the budget there's over $100 million that flows into home visiting through the counties, through the CalWORKs distribution. And that's one where we can look at options for maximizing those resources that already exist, and that is something we're looking at. Mm-hmm.
I'm going to say something. Always. I think my concern is that we've invested a lot of our state money, thank you very much, Dr. Byrd, in getting people off the streets and putting them in incarcerated or locking them in hospitals or whatever, which is kind of too late. And I'm a little discouraged about the lack of funding or the diminished in funding dealing with 0 to 5 or with families early on to prevent them from needing those services. I don't set the policy for the state yet, and I probably never will, but I would certainly want to see that we argue that more money goes into prevention, which is certainly what home visitation is, and I would echo what Deanne's saying in terms of looking at targeting the highest risk families and highest risk areas, and maybe we should partner and create resource centers as pilots in the highest risk areas of the county that look at home visits, certainly, but a real access to resources rather than 211, but a real access, and health and mental health access early on, and just see the impact in that community, and that's community driven, which I think we all in favor of. And I know we don't have the funds due to it across the board, but maybe we could we could be a policy maker and see if DCFS, DMH, and the public school system would like to create a triple wide trailer on the grounds of the elementary schools in the highest risk neighborhood and begin to talk about prevention, intervention, home visitation, the whole thing at that level. And I don't know, just a thought, but I am very discouraged about money going to putting 16-year-olds away rather than dealing with them when they were 16 months old. But I mean, that's why I'm a 4 on the 1 to 10 scale right now in terms of delivering service, is because 60% of the people on the street are graduates of the foster care system. right? 60%. So if you really want to talk about prevention and getting people off the street, you start very early on talking about what do you do to sustain a family so that that child doesn't end up in foster care, which we're not talking about. So anyway, that's one of my soapboxes this week.
Okay,
I think that if we consolidated funds and did that, we would demonstrate, A, we could afford to do that, we could take credit for doing that, and we could show a definite change in the community. And it could incorporate everything we're doing with, community-driven, helping people have access to what they need. And I mean, it's a logical step to take. It's multidisciplinary, community-driven, and what they want, what they need. And in doing that, we could access funds that are sitting out there saying, we'll help you, help families in need, and sustain them where they are. But the way it is now, it's so chaotic that, I mean, there's one huge fund in LA that will help us to help families, particularly if they're at risk for DCFS. They do not want to see kids going into foster care. But how do you access that? So, because it's a prevention strategy. Let me know if you figure it out.
So in adding to that, I think what we're hearing really, really clearly is the targeted resources for this investment, making sure we do that. Hearing really clearly, let's leverage our county relationships and partnerships, and this idea of our unique expertise, and how do we bring that unique expertise to services that are needed in programs. So I think we could take that as guidance as we continue to noodle through this question of what home visiting will look like. Thank you.
and the last thing I would add is that as we're looking at these funding options, like how are we using data to actually inform where those services go? Data around what's been successful, but also around our equity mapping in the county.
Which is a great segue to the next item.
But before we go to the next item, Ms. Vo, are there any public comments on this item?
Yes, we do have one public comment committee, Bird, and that's Winnie Wexler.
Yeah, hi. Thanks so much. Excellent presentation, and it just really made me start to question. I'm making less of a comment and just asking some questions, because I think the questions you're asking are the right ones. How can we figure out how these future revenue streams can continue to fund these critical services? And so one of the questions I had was, I would imagine the other First Fives in other counties are also thinking about how to leverage for Family First. I don't know to what extent the state California operation can help you or help LA County, because you would think they should be helping all the counties figure this out. And likewise, here in LA County, we have the advantage of partnering with Chapin Hall on a lot of the Family First analysis. And so some of the questions that you raised, which are the right ones about how do we actually transition from, grant money to all this, money that might come in dribs and drabs from multiple sources over extended periods of time, they can maybe help refine that analysis and then make you help you to understand maybe this is more of an opportunity. Agreeing with you, though, that we're not going to see Family First dollars until at least 20. The state hasn't even given us an estimate as to the date, since they are relying upon first creating this data system that has no date for being rolled out. But that being said, as you said, the block grant until then. So I think the more we can refine your analysis, we can then prove, okay, this is a plan that deserves to be supported and implemented. So I'm also volunteering to the extent it's helpful to help you explore those things.
That does conclude our public comments for this item.
Thank you. Thank you both. We're going to move on to item 7. And item 7 will be a brief overview on First 5 LA's Equity Index. And I will hand it over to Kim Hall to lead, allowing her a second to settle in. Thank you. Thanks.
Good afternoon, Commissioners, staff, and members of the public. I'm Kimberly Hall, the Director of Impact and Accountability, and I'm excited that today we're going to begin a conversation about the development of an Early Childhood Equity Index. In the brief time that I have with you today, I'm going to introduce the concept and the rationale. I'm also going to share with you where we are in the process, so what we've done thus far and what's coming up next. And finally, I'll pose some questions to get your input. So staff are exploring the idea of developing an equity index focused on conditions of well-being for young children and families. An index would provide a single score that really gives us a sense of how children and families are doing, that takes into account multiple indicators of well-being. So in contrast to looking at indicators in isolation or sort of one by one, looking at each condition, an index would allow us to consider different facets of well-being simultaneously. So to be clear, an index wouldn't negate our need to really have a deep understanding of specific issues or specific conditions, but it would be a tool for helping us to identify where the most significant and pervasive geographic and racial disparities exist, so that we can target our resources and efforts accordingly. You might be wondering, why does First 5 LA need an equity index when there are already a plethora of existing indices? So one of the things that we've done thus far is to look at the landscape to see what already exists. And based on what we've seen, there's really been a proliferation of equity indices in recent years as issues of systemic and structural inequities have come to the fore. But really the answer to the question of why we are thinking about developing one is that given what we've seen in the landscape, there isn't anything that exists specifically for our target population. So we're focused on early childhood. Many indices are looking at the entire population. There are some that are focused on children under 18, but given our focus on early childhood, there seems to be a gap. Some of the other limitations of what exists or some of what we need specifically are indices that help us to look at LA County and the different and diverse communities that exist within the county. So if we want to figure out how to target our resources within a county and where disparities exist, an index could help us to sort of realize that and look more closely at specific geographic areas and populations. Finally, we need an index that focuses on the conditions that we're trying to change through our strategic plan. So of the existing indices, some of them focus on very specific issues around health, around economic opportunity. They have very specific areas of focus. And so what we're looking at is one, as this slide indicates here, that's focused on early childhood, on LA County, and that aligns with our strategic plan. So you may be wondering how we would use an equity index. Well, I want to start by saying that the idea of developing an index emerged in response to conversations that have happened among this board about the need for First 5 LA to target our resources, especially given our fiscal context. So in light of what we're hearing from the board, our thinking is that we can use an early childhood equity index to inform how we're allocating our resources, to ensure that we're allocating our resources to communities that experience the most disparities. We can also use an index to target and tailor the efforts that we implement to specific communities and populations. So an index, not only does it represent a global score, it's one that we can look at specific geographic areas and get a sense for how's this particular area doing, or how is this specific population doing across a number of indicators. So now that I've shared with you some of our initial thinking about an index, just kind of that idea or the concept, I want to give you a sense of where we are in the process. So our work really began with direction from leadership, growing out of the conversations happening among the board. As we got that direction, we thought, okay, well, let's take a look at what's already out there. So we've done an initial landscape. We've looked at dozens of indices to see what are they focused on, how are they being used, what kinds of variables are they measuring. We want to get an understanding of if there's something out there that could meet our need. And even if there isn't something that specifically meets our needs, are there existing indices that we can maybe build on or supplement or really focus in a way that could help to support our goals? We're now entering the phase where we'd like to gather additional information. So our landscape was pretty much looking at what's available to us on the internet, through information that exists. But we'd like to go a little bit deeper and start to gather more information to get a better understanding about what's out there and what our specific needs are and how we'd like to use an index. Once we've done this additional information gathering, we plan to develop a framework. That framework is going to kind of give a sense for what are we talking about measuring? How are we going to score? What are we going to include? We want to get into some of the specifics. And then finally, once we have the framework and we know exactly what it is that we want to include in the index and how we want to use it, we'll move into actually designing and implementing the index. And then finally, we expect that we're going to need to refine it over time. So this is an ongoing process. And one of the things that I do want to note is that throughout the process, we expect to engage key internal and external stakeholders. So the data team within First 5LA is sort of taking the lead in thinking about and conceptualizing the index, but we can only do so by understanding both the need internally as well as what's happening outside the organization. So in terms of next steps, I want to just share what we're going to be doing in the near term. There are 3 things that I really want to highlight here, and kind of spoke to them on the last slide, but just want to highlight these. So as I mentioned, we're moving into information gathering. And when we say that, we're thinking about both internal and external conversations. Internally, we want to talk to our staff to make sure we're clear about what are our needs. How specifically might we use an index when we're making decisions about investments and about tactics and initiatives? We want to understand what are some features that staff are going to be important for staff in an index. We also want to talk with people outside the organization. We know that others are already using information about the population in LA County to make decisions. We want to know what's working in terms of what's already out there and what are some of the limitations and gaps and some of the lessons learned. We anticipate using what we learn from internal and external conversations to create this framework. And as I mentioned, the framework is really going to get into the content. So what domains are we looking at? We talk about well-being. Well, what do we mean? Are we thinking about well-being in terms of physical health, mental health, social skills? Like what specifically are we looking at? And what are some of the indicators we are going to include? We also need to think about things like scoring, and so that gets a little bit more technical. But when I talk about looking at different facets of well-being, one question is, do we weight them all equally? When we're making decisions about how we use our resources, are some conditions more important than others in terms of how we determine the level of need for a specific area or population? We also have a question of, do we want subscores? If we're looking at domains, would it be helpful to know how different communities vary when you're thinking about, physical health or mental health or other areas? So information gathering will support development of the framework, and what we are planning to do in terms of our next engagement with the board is to come back to you in June and sort of share what we've learned through information gathering. We also want to get your input on the emerging framework. We expect to do a lot of the work in terms of design over the summer, and so what we'd like to do is have a conversation with you to let you know what we're thinking and to get your input and your guidance as we continue the next steps. So now that I've provided a very brief overview, I'd like to pose some discussion questions. So there are 3 here. Curious to hear what questions you have. Would also like to know your thoughts on the potential benefits of an index, especially given our fiscal context. So a part of this thinking was informed by the board saying you need to figure out how to target your resources, and we're proposing that an index can help us to do that. And so wanting to hear what your thoughts are in response to that and some of the benefits that you see. And then lastly, if you have ideas about the kind of indicators, the kinds of conditions that we should be looking at given our strategic plan, and that we want to make resource allocation decisions that align with our strategic plan, what are some of those conditions or indicators that we should be looking at including? So that concludes my presentation, and I will open it up for any questions or reactions.
Thanks, Kimberly. That's great. And I, again, would like to see us move from equity to excellence in every community. Let me give an idea out there, all right? Just for the discussion potential. And because Robert's trying to keep us on time and I'm trying to undermine him. You know, years ago, I took a proposal to the university campus of USC, and the idea being is, how do we build a community that embraces nonviolence and excellence for everybody that lives there, thinking about communities that really didn't have power in our society, and how do we build it by bringing in a focus on education, on health, on access to legal services. And I sit on a board of trying to change access, legal advocacy for teens in various communities. The idea of how do you structure parks? How do you do urban planning? What does the architecture looks like? How welcoming is it? In other words, bring in all the different disciplines. And maybe we could palm this off on a project at a university to create my thought process. I was bored at the time, so my thought process went to the idea of creating a minor for individuals seeking a master's degree in a field that would look at building equity into communities, building a sense of safety. Like how would we engage various entities within the county to go in and put a park in, or make a walking road, or how do we bring shops back in? How do we have a healthy food? In other words, we create a different image, because we all know that we live in a world in which there is inequity everywhere, especially for minorities and poor people. So how do we do that? How do we get street sweepers to clean the streets? You know, those kinds of things. I'm just suggesting that instead of just, that we know that, we sit around this table, we understand inequity, maybe asking for a university that's wealthy and now has 7 Heisman trophies in their athletic hall. And ask them if they would be willing to work with us on building the different disciplines together at their cost, not at our cost. I made recommendations on how do we change communities. I was commenting in my own mind. I drove down Central to Central and Adams down that direction yesterday, and noticing all the absolutely gorgeous houses that are built from the turn of the last century, and wondering what would happen if a community of young people came in there and offered to help, landscape, clean, paint, make a walking street, create a park and an empty lot. I mean, like, what would happen if we're looking at a community that they invest in themselves and bring the community in to engage? That's just telling you, Kimberly, that was a boredom factor 22 years ago in my life. The idea of how do you build a nonviolent community. I think that's a question that could be asked. And again, it goes back to Resource Center and giving pride back to communities rather than, it's a thought.
Well, thank you first for your presentation. I think it's really important to be able to come up with an equity index. I think, data will always help us make better decisions. And having this information is also really helpful because earlier somebody mentioned like duplication of services, right? So like if people are looking at the same equity index, right, like this will help us be able to look across agencies to see how people are being served. And finally, I just wanted to make a comment about making sure that in the things that we are paying attention to, we go beyond access to actual engagement with services as well.
And I believe that university might actually have a school of social work that could be helpful in this arena.
I was thinking about social work, architecture, urban planning, governments, all of that
Relations,
stuff
yeah.
that they have, all those divisions down there, education, legal, medicine even, though we're in a different campus. But I think, I have just a thought. We have limited resources, and I like to know that somebody's gone down and mowed that lady's lawn that I saw down off of Central. I mean, I want action is what I'm saying.
Please, Commissioner Segala.
Thank you. I agree with you. I think that we should seek out universities. I think USC would be a nice place to start. And also the richness of the data itself being used as an indicator. I really love that idea. I thank you for championing that because I think it's well needed.
Thank you. I have a
Yes.
Quickly, I just want to also thank you for your presentation. And on the slide where it talks about how we can use the equity index, and you mentioned to inform the allocation of resources and to target efforts. I'm not well-versed in the stock market, but I know an equity index also measures like the market change. And I think this would be a good way of really honing in on the impact of the work that we're doing and how to measure that so we know what is actually the return on our investment when we are trying to do fewer direct services and have a larger impact. So I really appreciate the thoughtfulness behind this because that's where we can hopefully start to, in the long term, identify ways that our changes today have had sustainable impacts on the community.
Yeah, I really appreciate that. One of the things that we noticed when we were conducting the landscape is that some indices, they do sort of track scores and changes in scores over time. So they're measuring need and they're looking at whether the level of need changes, which I think is kind of what you're speaking to.
Absolutely, and it can allow us to adjust closer in real time to the growing or changing needs of the communities we serve over the years. That's right. Thank you.
So, I mean, will it be helpful? For sure. I think that without question, an index will be helpful. I also think that Carla and I had a chance to talk last week, and I shared out with her some of the outcomes that the Children Youth Behavioral Health Initiative is looking at. Because we sit in common places throughout the county. And to the extent we can align with other outcomes, other indices that are being used in other spaces, I think that that would be welcome from our provider communities who have to implement and report out on. I was on a call before coming here today with the Mental Health Services Act OSC, and they were presenting about some of their thoughts and why they aligned things the way they did. And the communities and the priority populations that they've identified for the Behavioral Health Services Act are aligned with the Medicaid population. So I think that that becomes another nice connection, given the percentage of children in the state and in LA County that are on Medi-Cal. So the more we can have those intersections and leverage what we're already going to have to report out on, measure what we're already seeing as change identifiers, I think that that would be fantastic.
Thank you.
So, Ms. Vo, are there any public comments on this item?
Confirming there are no public comments on this item.
Fantastic. So let's move on to item 8. Thank you again for your presentation. I'll tell you about a parks project I have in the works. Item 8 is a presentation on First Five's advocacy priorities for 2024. And I'm going to hand this over to Ophelia and Jamie to take it away.
Apologies about that. We were trying to figure out time for the rest of the evening or afternoon. Good afternoon, Commissioners. We're really excited to come back to you today with a discussion and review of First Five LA's recent policy and advocacy efforts. This conversation is very timely, as the Public Policy and Early Care and Education Department is actively engaged in advocacy efforts, even as we speak right now in Sacramento, as we near the halfway point to the federal and state legislative cycles. Before we start, I want to give you an overview of the brief time that you have with us this afternoon. We will begin with a brief overview and review of our most recent policy agenda and how it guides our policy and systems work, sharing how it is grounded in First Five LA's commitment to equity and community engagement. After that, we'll do a very high-level context and priority overview for our state and federal opportunities, since there's a lot of pieces moving. And then finally, we'll dive into our policy and federal priorities, along with our government affairs engagement so far. To get us started, I want to quickly review our role and orientation to the functions of our First Five LA policy agenda. First Five LA's 2024 policy agenda was approved by our Board of Commissioners last fall and acts as the authorizing document for First Five LA's policy and government affairs work. We require an annual board approval of our policy agenda so that we as an organization can take positions on proposed budget, legislative, and administrative proposals. Based on our 2024-2029 strategic plan and learnings and discussions from our program colleagues, we will again work to update our policy agenda later this fall and come back again sometime in the fall to approve our 2024 policy agenda. So believe it or not, we're already working for next year. Now I want to quickly ground us and highlight a few of the foundational pieces that dictate how and where we show up in policy spaces. In an ongoing process, we continue to center equity in all of our work, and we see equity as a value as foundational for our overall policy agenda. Promoting equity and working closely to close disparities are not separate or individual priorities, but rather they are front and center to our work and embedded throughout and across the entirety of our policy work. As such, the 3 overarching goals within our policy agenda, specifically for 2024, are to work to close race-based disparities across health, well-being, and opportunity, utilize best available data and advocate for the ability of full and complete and disaggregated data, and promote a holistic system of supports that are linguistically and culturally responsive. This overall orientation is grounded in a commitment to close disparities and ending inequalities that impact many children in LA County, because we know that disparities exist even before birth, especially as we saw the presentation earlier today. The 2024 policy agenda features 4 interconnected priority areas. Specifically, the agenda is centered on a whole child, whole family framework with priorities mutually connected as part of a broader framework and agenda, hence the puzzle illustration on the screen. The whole child, whole family framework recognizes the interconnections of multiple domains of child development and that child well-being cannot be separated from broader family stability and social determinants of well-being. As such, the 2024 policy agenda seeks to uplift key interdependencies across systems, and the four overarching goals for our policy agenda are to promote a comprehensive system of family supports to advance positive outcomes for the whole child and the whole family, to improve systems to promote the optimal development of children through early identification and supports, to expand access to affordable, quality early care and education, and to ensure communities have the resources and environment that supports optimal development for children prenatal to 5. Before I turn it over to Jamie to walk us through our current and current state and federal priorities, I want to set the policy context for both the state and the federal governments currently. As a reminder to the board, back in 2023, Sacramento welcomed its largest class of freshman legislator in over a decade, and voted a new Assembly Speaker and most recently a new Senate Pro Tem. This means that we have a new era in California politics, making the legislature its most diverse ever. While this is exciting, this has also meant that we have very few policymakers at the Capitol who have experience working in a budget shortfall rather than a surplus like we've been operating. And we also have a large number of policymakers and their staff that we need to engage and educate on child development. In terms of the state budget, we are seeing back-to-back years of budget deficits that have shifted ongoing discussions to focus more on protecting investments made over the last 2 years rather than increasing funds. The governor and the legislature's analyst office have also been debating whether we see a 38 billion or closer to 73 billion state deficit. So those conversations have been very interesting. Early action on the governor's budget was taken by the legislature earlier this month to try to buffer the impact of significant budget shortfall prior to the May revise that we're anticipating next month. Early actions include program reductions, delays, and borrowing, which include a reduced budget shortfall by about 17.3 billion. However, as we know, the legislature can still revisit, change, negotiate, and expand upon early actions all the way until the June final budget. On the federal level context, after several continuing resolutions, Congress finally passed a fiscal 24 appropriations package worth $1.2 trillion. First 5 LA advocated for several early childhood programs that received funding increases, including CCBDG, or the Child Care Development Grant, Block Grant, Head Start, and WIC. Now, for fiscal 25, appropriations conversations have also started, and we're focused on supporting and advocating for legislation that aligns with the policy priorities for the remainder of the year. I'll now turn it over to Jamie to close us out by discussing our state, federal, and government priorities.
Great. Thank you, Ophelia. Good afternoon, Commissioners. Now, since the beginning of January, as Ophelia had just mentioned, our policy team has essentially been reviewing every single state and federal policy proposal that might align with our policy agenda. This could be legislative, budgetary, or administrative. Thank you. Now, at least with respect to the state budget, we're standing in coalition with our partners over at the EC Coalition, specifically in the EC space, to continue to push for childcare spaces to be appropriated, that were appropriated in last year's budget and to be awarded and distributed by June 30th, 2024. Overall, essentially, we're asking for the state to keep their multi-year promise to add 200,000 spaces by FY 2006-2007. Additionally, we continue to urge the administration to prioritize childcare provider rate reform by continue to work on the implementation of an alternative rate methodology in collaboration with providers, families, and advocates. As with last year, one of our top priorities also in the health system space is continuing to advocate for resources that will support the continuous eligibility of Medi-Cal services for children under the age of 5. One of the other additional last priorities within the state context is continuing to prevent cuts related to the CalWORKs program. Considering we understand this is a program that really does help lift families out of poverty and really does support their healthy development. One piece of this too also that we're trying to ensure that we're providing a lot of advocacy tactics around is making sure that we're advocating against any redirection from the CalWORKs safety net program to programs that are outside of the CalWORKs system too as well. With respect to legislation, I think we had mentioned the legislature introduced over 2,000 bills this year. So ultimately, our team is working to analyze a few bills that might align with our policy agenda. We just took positions on 2 pieces of legislation most recently related to our policy agenda, which are AB 2268 and AB 2319. The first one, AB 2268, seeks to exempt TK students from being tested for English language proficiency using the English language proficiency assessment of California until a developmentally appropriate solution can be created. With a large percentage of young dual language learners entering the TK through 12 system, we want to really ensure we are supporting their linguistic and cultural assets. The second bill is AB 2319, related to updating and improving the implementation of a bill that was mentioned earlier, SB 464, which mandated hospitals, alternative birth centers, and primary care clinics to implement implicit bias training for their staff. Now, the bill that was just introduced would essentially put more teeth onto the original bill, which would establish firm deadlines for penalties for noncompliance and incorporate the recognition of non-binary and transgender birthing populations. 2 additional bills that you might see on the PowerPoint are AB 2982, which is a bill sponsored by the First Five Association, which seeks to create a statewide prenatal to 3 work group. Additionally, we're continuing to monitor SB 1396, which would extend the length of the CalWORKs home visiting program to a minimum of 24 months and extend the enrollment period too as well. Administratively, we've been pretty busy too as well. One major process, which we talked a little bit about, is we're continuing to monitor the California Department of Social Services early learning rate reform implementation. Besides monitoring and attending the rate and quality advisory panel meetings, First 5 LA is currently assessing what First 5 LA's added value will be in the next year as a new cost methodology is implemented. In terms of our advocacy around CalAIM and the new Medi-Cal benefits implementation, we continue to monitor opportunities to improve that rollout as well. Like last year, we are monitoring the doula implementation work group, which is tasked to produce a report on the utilization of doula services. And this year, First 5 LA actually became a member of the Community Health Workers and Promotoras Representatives Coalition. Finally, closing out this portion, we wanted to provide a high-level update on the universal pre-K implementation. And to clarify, the universal pre-K is essentially the umbrella term that we use that encompasses universal transitional kindergarten, which was enacted in the FY 21-22 budget and is sent to be fully implemented in the FY 25-26 budget. To ensure an equitable rollout this program, the state created the UPK Mixed Delivery Quality and Access Work Group, led by the California Department of Education as well as the California Department of Social Services, to develop recommendations for preschool quality standards and review practices to expand access to high-quality preschool programs in the mixed delivery system. Federally, we've been busy too as well. Most recently, President Biden released his proposed budget for the fiscal year 25, which included several early childhood priorities that we're going to be monitoring, which essentially includes expanding the earned tax credit, the child tax credit, extending the Medicaid and Children's Health Insurance Program existing 12-month continuous eligibility for children to 36 months. And now, while the president's budget is mainly symbolic, it really does serve as a foundation for our team to continue to think about advocacy going into next year. With regards to legislation, we've taken a few positions on a few high-level bills related to this, including the Tax Relief for Americans Family Working Act, which essentially expands the tax credit. Additionally, we've taken a position on the Child Care Stabilization Act, which would increase child care options for working families and for child care providers too as well. Again, we continue to support the Farm Bill reauthorization, which would increase and expand support for the SNAP program. Administrative too as well, we are doing some advocacy around tracking and developing our own strategies to leverage a McV funding opportunity that is being administered through the Health Resources and Services Administration. And now I'm going to talk quickly about our government affairs priorities, which essentially, in a nutshell for the commissioners here, is a way we ultimately engage elected officials to be champions for children. So we do that in an assortment of ways. I will say, Ophelia just mentioned we had an election recently, so our job is to educate and uplift early childhood with many of our elected officials here in California. Specifically within the LA County delegation, which is about 38 members, Congress is about 18. We rely heavily and focus a lot of our attention to the Legislative Women's Caucus in Sacramento, who have been huge proponents of our policy priorities in Sacramento the last few years. Additionally, our team is in Sacramento. They're in Washington, D.C., doing a lot of this advocacy work directly with legislative staff as well as with elected officials. More so, we're actually in the districts too as well. We attend many of the elected official events elevating these priorities. We've most recently been holding several early childhood site visits with some of our partners and elected officials too, again, to try to educate and lift up our priorities with elected officials. Again, we just had an election, so we're going to have 12 new state policymakers in LA County, as well as 3 congressional members. So for us, that's a huge opportunity, and what we'll do in the summer and fall months is begin to contact several of these candidates to participate in our candidate education program, where essentially we talk about First 5 LA and who we are. We try to get them early, so when they are members, they know who we are. I'll try to wrap up quickly. We are continuing to engage one of our bigger champions, Congressman Jimmy Gomez, who actually founded the Dad's Caucus a couple of years ago to focus on some of these issues. One of the more exciting projects we are actually working on now is First 5 LA Day in Sacramento, which will be June 12th, which will provide an opportunity for our team, as well as the commissioners, to go up to Sacramento to advocate on many of the priorities that we just talked about with state policymakers, committee chairs. Hopefully you will be receiving an email soon from Carla that will be all inviting you to participate if you would like. I think everybody in my front panel here has participated in Advocacy Day at one point, whether it was virtual or in person, so we welcome you. And again, I'll just wrap up by saying we do a lot of work in coalition with partners in the EC Coalition, the Community Health Workers Coalition, as well as the Whole Child Equity Partnership, as well as non-early childhood, which would include the LA Chamber. We've been participating in some of their advocacy days in DC and Sacramento, as well as locally too with a couple ECE groups. So with that, I'd like to stop there, but also acknowledge that there was a lot thrown at you, and we have a few minutes for questions. So for one question, so I think we made it just in time.
So I imagine, thank you for this presentation and making it so thorough. I imagine it would have been included if there was something related to it, but are there any bills or legislation that you are aware of on the horizon concerning early identification or early and intervention, especially considering public schools, the CARES funding, ESSERS, it's all sunsetting, and schools are now facing like reduction, they're having to do some budget cuts, and a lot of the increase in the social emotional learning, mental health, early intervention came from some of that additional funding over the last several years, and with younger children entering TK, the need for early identification is greater than ever before. We're seeing more students entering schools at younger ages already displaying, behaviors that might indicate that there is a developmental delay. Is there anything that's on the horizon to address that?
Well, there are a couple of bills that we are tracking. The question was also like, are there any state bills that you have seen that we should take a look at? SB 1112 is one of them. It's specifically on a child care setting. The tricky part with that one, and it's the bill that we haven't taken a position, is we continue to monitor, but we're asking, at least in this bill, providers to do a lot of the early identification work when we already have providers doing quite a number of things and not adequately getting paid. So there are a couple of bills. That's one that immediately came to mind, but it is something that we have in our tracker as well.
Okay, thank you.
So thank you very much for your presentation. That was the one question we could take. So I'm going to ask Ms. No, unless anybody else has a comment. Okay. Are there any public comments on this item?
We do not have any public comments on this item.
Fantastic. So are there any public comments on items that were not on the agenda?
Confirming there are no public comments for items that are not on the agenda.
Thank you very much. Thank you, everybody, for your time. Those who called in on Zoom, thank you. And we're going to adjourn the meeting.